Hello, everyone. Can everyone hear me okay? Cool. All right. Well, welcome to direct service training. Um, nice to see. I don't think I've met any of you, so
Can you hear me? It's Michael.
yeah, I can hear you.
I cannot get my camera to work on this computer.
That's okay.
Yeah, sure. All right, because I
Yeah,
mean I
yeah.
could jump on my phone, but it's gonna be a little harder to see.
It's a For as long as the training is, I feel like it's hard to like hold up a phone. So like
Yeah. Oh
it's
yeah.
totally fine. I'm flexible, so don't
I,
worry about it.
I spent 30 minutes and I don't know if it's broken or what. I just can't. I apologize.
Technology is great.
Yes.
Is that instead when it doesn't work, then it's not the best thing. So I totally get
All
it.
right. Thank you. I'm sorry.
No worries at all. So yeah, well, welcome. So this is direct service training. Um, my name's Sarah, and I will be covering trauma informed service, and then also like self-care, and how to take care of ourselves whenever we're in the helping profession, whether that's being a therapist, an advocate, working with our legal team, even working at the thrift store. It pretty much is sorry to admit someone else. It pretty much is accurate with any facet of this organization. So just a little housekeeping things just to make sure we're all taking care of ourselves during the training. So the training, this first segment's like 4 to 6. The second is from like 6 to 8. So I plan on taking like a 10-15 minute break between the two segments, so everyone can like get up, stretch. It's a long time to be sitting and learning a lot of different material. And then also during this process, like at any point, if you feel like you need to turn your camera off, take care of yourself, get something to eat. I know it's like prime time dinner time, so if you need to get something to eat, get a snack, get water, like all of that is fine. So just like to say that in the beginning, because sometimes you get into trainings and you don't always know what you're allowed to do. You're allowed to do whatever you want, basically. Um, so that's kind of my style. Um, and then just another disclaimer that a lot of the material that we're going to go over, it can be traumatizing, it can be triggering. Just because we all come with our own trauma stories and things that, you might have heard some of this information before, some of it might be new. So I just like to say that too, because, it can bring up our own stuff and we can become activated and not even realize it. So you're in good hands. So a little introduction. So I should have started that way, but I'm going a little out of order. My name's Sarah Miskell. I am a licensed trauma therapist. I'm also a therapy team coordinator at a woman's place. I've been here about 8 years, and I primarily work with trauma survivors in like more of like an individual basis. I'm new to doing trainings, but here I am. I'm happy to do it. Um, and I supervise like our interns and other therapists that we've had. And I primarily come from like an EMDR perspective and interpersonal family systems. So I do a lot of deeper trauma work with our clients. Um, Also, we have our counseling team as well. So we have a counseling department and therapy. So we're all kind of like one, but there's like different teams, but we're all under counseling department. So like our counseling team does a lot of like the crisis interventions with clients and survivors. Also we do a lot of psychoeducation around domestic violence, the differences between domestic violence in terms of like intimate partner, family violence. Um, there's a lot because we get a lot of calls too now about family violence, not just intimate partner. And then also I always like to address our name is a woman's place, but we don't disserve women. As we know, any individual can be a victim or survivor of domestic violence. So I like to say that only because we're very inclusive. We're just trying to get the message out that like no matter how you identify, um, that we're a place that can help you. Um, I'm trying to think what else. Any other things that I think are important. Oh yeah, and this is a really like conversational training. So like for example, if there's any questions, concerns, anything that comes up, it's not one of those kinds of trainings where you have to wait till the end to ask questions. So as they come up, if I guess maybe the best way if maybe you raise your hand on one like on your like the emoji if you guys know how to do it on there, and then we can kind of go from there. I'll also check in too probably every few slides to see if there's any, clarifications, questions, concerns, anything basically. So that being said, I'll check in now. Does anybody have any questions or concerns based off of anything so far? No? Okay. All right. So let me start. So yeah, so basically this is the first segment is providing trauma informed services. So this is pretty much just about how we have come to be a trauma informed agency and how all of our services come from a trauma informed perspective. Okay. You would think I love to know how to do this. I do. All right. Did everyone see it okay? Okay. Okay. So today's training is about trauma informed care. So trauma really does confront you with the best and the worst. You see the horrendous things that people do to each other, but you also see resiliency, the power of love, the power of caring, the power of commitment to oneself, the knowledge that there are things that are larger than our individual survival. And in some ways, I don't think you can appreciate the glory of life unless you know the dark side of life. So this is a quote from Besser van der Kolk, and he's a really big person in the trauma field, and that just kind of captures a lot about what his view of what trauma is. Um, let me just hold on just one second. I'm just trying to move you guys around so I'm not like looking around. So hold on one sec. Okay, there we go. Okay, so only when we are brave enough to explore the darkness, we will discover the infinite power of our light. I'm not sure if you guys know about or ever heard of Brene Brown, but she is really awesome. She has a lot of TED. She's kind of started off with like TED Talks, and she talked a lot about like the power of vulnerability, and did research behind the human emotions of like guilt and shame and other things like that. So she's someone we actually just ran a support group called Braving, and that actually is based on Brene Brown's work and her research. So she's a big deal. She's a big deal. Um, so our goals and objectives basically is participants will be able to describe trauma from a survivor-centered perspective, understand both the short and long-term impacts of trauma, explore an array of emotional, physiological, psychological, behavioral, and physical reactions to trauma, um, define trauma-informed care, explore resilience and coping skills, healing methods for trauma survivors, and also explore a woman's place counseling and therapy services for trauma survivors. Okay. Sorry, does anyone know how I can get you guys on the top? I don't use Zoom ever, I use Doxy. So I'm just trying to, so I'm not like moving you guys around. Hold on. Just playing around with it for a second. Okay. I think it's always the technical stuff that's the problem.
Don't worry, I can't even figure out my camera.
You know what? That makes me feel better. It does because that happened to me before during a session. So it just shows that we're all human, like it happens. So I feel like there's like no great place. I want to make sure I see everyone. So that's what I'm trying to figure out. Okay. Just gonna work with it. There we go. I'm just gonna put you guys in the corner, but I will be mindful of the chat. Okay. All right. So, I think I just skipped a slide. Give me 1 second. Sorry for this. This was my worst nightmare happening. So this is just the transparency of a presentation. Okay, so what is individual trauma? So it's a unique individual experience of an event or enduring condition in which there's a significant threat to life, body, integrity, or sanity. The event or series of events can affect the capacity to cope and the ability to process an emotional experience. It's highly personal and subjective and can impact social and biological development. And how I always describe to my clients is the last sentence, which it's a normal response to a really abnormal circumstance or condition. So basically, it's like when people experience trauma, their response and like the physiological and psychological response is normal, but what's happening to them is really abnormal. It's an abnormal experience. It's not something that's, driving to work or, something that's like a common day thing. Okay. And then what is collective trauma? So it's cumulative, it's emotional, psychological, and spiritual wounding over the lifespan and across generations. This is important when incorporating human rights social justice lens to our advocacy work. We must work to understand the social, political, and economic context of trauma. It is important to think about the cultural, community, and family context of trauma. Being trauma informed means understand the pervasiveness and impact of trauma, as well as addressing the underlying conditions that promote abuse, violence, and oppression. Individual and collective trauma can increase a person's risk for victimization. All services provided at AWP must be accessible, culturally responsive, and trauma informed. And just in terms of like our services and who we help is we help anybody that identifies as a victim or survivor of domestic violence. So we work with children, we work with adults, we work with parents, we work with people that are in the older population. Like we work with everyone. Pretty much the only thing that would be an exclusion would be if someone were to be a perpetrator. Obviously, we only work with victims and survivors. Um, but in terms of as long and also the other qualification would be we serve Bucks County. So we can help people that either reside in Bucks County or if an incident happened in Bucks County, we can also help them as well. So does anybody have any questions so far? Just kind of checking in, see where everybody's at.
I have a quick question, Sarah.
Sure.
What if someone is a victim or survivor, but also a perpetrator?
Sure. Can you explain a little bit more, just like what you mean by being both in terms of how you would how that person would identify?
Okay, cool. Thanks.
Oh no, I was
Yeah.
asking you. Sorry, I was asking you, like
My
it's
thing
okay.
cut out, so I thought you answered, and I was like,
No,
oh,
no, no, no,
okay.
no, no. Don't worry, it's okay.
So,
Technology, we love it, we hate it. I was just wondering, like, can you just explain a little bit more in terms of like
yeah.
how they would identify as
So
both?
if they say we're a perpetrator of abuse, but then disclose that as a child they were a victim of abuse or something like that.
Okay, I get what you're saying. Like so basically, I guess how it would work. So if someone were to call and be a perpetrator of domestic violence,
Mhm.
that would be a different program, wouldn't be us because we work with victims and survivors.
Yeah.
But I would venture to say too that a lot of people that are perpetrators even of domestic violence have a history of some type of childhood abuse or have been victims at some point.
Okay.
So like basically it's like when they call the hotline, that's like the first point of contact. And when they call the
Mhm.
hotline, they get all the information because you're kind of saying, okay, what was the last incident that happened? What's the perpetrator's name? Like that's kind of like the screening process, just to make sure we're not excluding the victim or survivor from being able to get their services because we can't work with the victim and the perpetrator. It'll be a conflict.
Got it. Got it.
So, but yeah, definitely, because that's so true with being a victim at some point, absolutely, of
Mhm.
some type of probably physical, sexual, emotional, financial abuse.
Okay. Thanks.
Sure, of course. Anybody else have any questions so far? No? Okay. Okay. Um, right. So common responses to trauma. So how do people react to trauma? There are four common clusters of the body and brain's response to trauma. They include hyperarousal. So this refers to the physiological or body changes that occur in the brains and bodies of trauma survivors, which prepare them to respond to perceived danger. You might feel like you are constantly on the alert for danger, startle easily, feel like you are on all the time. These physical responses can occur weeks, months, or years after the event. So when a person's reminded of the trauma, people may move between extremes of hyperarousal and numbing. There's also intrusion or re-experiencing of events. So these symptoms refer to the experience of the trauma intruding upon your life after a traumatic event is over. This involves having memories of a disturbing event when you don't want to or you weren't thinking about it. This often makes people feel that they aren't in any type of control. The third kind is constriction or avoidance reactions. So often our brain responds to stress by keeping us safe through ignoring or avoiding anything related to the trauma. This can include numbing of feelings, thoughts connected with the traumatic experience. You might feel the urge to avoid all circumstances associated with the trauma and may withdraw from others as a way of seeking emotional safety. And then the last one's emotion and attention. So people may move between extremes of absent emotion and overwhelming emotion with regards to attention. People may move between extremes of dissociation and hyperfocus. So does anybody have any questions about the responses to trauma at all? If anything stood out, any clarification or anything? Okay. Okay. And then the next one's about trauma and how it affects the body. So there's normal stress, which is also known as good stress. So it's harmless, there's no long-term effects, and it's necessary for growth and survival. The brain will employ a normal stress response. So their sensory input to the brain will assess for a potential threat. The brain prepares for flight, freeze, or fawn. So this diagram right here is just showing you kind of like what your body looks like and how it functions when it's in a fight or flight response. So for example, the heart, it beats faster, pumps more blood, your blood pressure increases, you feel the blood increasing in all your muscles, blood decreases to your organs. And then in the endocrine system, you have it pumps out adrenaline, noradrenaline, cortisol. It constructs blood vessels. It produces fewer sex hormones, and it releases less growth hormones. And then with the lungs, you have breathing becomes faster and shallower, consume more oxygen, expel more carbon dioxide, and then the skin, you notice sometimes excessive sweating starts to begin. And then with the pancreas, you have, it pumps out I can't say the word, but I know what it is. Whatever, produces less insulin, blood sugar level rises. So this is just a good example of when someone can express like, I felt it in my body. I got triggered. I don't know why I was feeling I was in this hyperarousal state or why I felt stressed out, but your body sometimes will tell you before you can, pinpoint into what caused the trigger or what the trigger actually was. And then just more information on trauma in the body is when a trauma occurs, their brain will respond the same way, but the outcome will be different. So physical responses, heart racing, trouble breathing, pain in the gut, feel like throwing up, trembling, headache. And then the hormones released during trauma. You have adrenaline helps with the fight, so the body can fight against a traumatic event, can also help with flight to try to run from the threat. And then you have cortisol, which affects the amount of energy the body has for its reaction, fight or flight. Opiates, body's natural morphine to counteract physical pain that may accompany emotional pain, could tie into the freeze response. And then also with the freeze response, you have oxytocin. So that increases positive feelings to counteract physical pain that may accompany the emotional pain. Could tie also into the freeze response. So repeat experiences of trauma, particularly trauma that's frequent, prolonged, severe, intentional, and presents a direct threat to physical and emotional safety, can result in actual physiological changes to the brain. So just checking in to see if anyone has any questions or anything. No. Okay. And then how trauma rewires the brain. So there's information processing. So new information is being processed through the emotion center, leading to stronger emotional responses, more likely to respond in fight, flight, freeze, or fawn. So this is just an example of what this can look like in survivors. So basically you would have the emotional stimuli, and that would go to the thalamus. That would be received by the cerebral cortex, and that would go into the amygdala, and then following all of that would be the emotional response. And all of this can happen in literally seconds. It's very quick. And this just shows when you have a traumatized brain is you have the emotional stimuli, and instead of it being able to go to the cerebral cortex, which is, in terms of our functioning, emotional regulation, it's going right to the amygdala. So that would be the difference between like, especially like early childhood trauma, which we'll get to a little bit later in terms of what the brain looks like. It's wired differently. And this trauma can begin in utero. So even before we're even actually born, our brains are being developed. And depending on, it could be the pregnancy. Was it a stressful pregnancy? Was it a wanted pregnancy? Was it a case of sexual assault, domestic violence? All of that can be contributing factors to trauma and the way that our brains developed even before we're born. So more about the traumatized brain is the brain short circuits. So the emotional stimuli bypasses the thinking objective part of the brain, which is our cerebral cortex, and travels directly to the amygdala. So there's no assessment of danger takes place to help the person talk about or understand what had happened. After repeated trauma, the pathway to the cerebral cortex becomes completely blocked. Individuals are now highly likely to respond to any situation perceived as a threat in fight, flight, freeze, or fawn, leading more to chronic hyperarousal. So like kind of examples of this is, something happens and then there's like a quick response to it. So you're not thinking about it, you're not able to ground yourself in the moment to emotionally regulate, to be like, oh, okay, like I am upset about this, but I'm going to choose to respond instead of react. And when you have a traumatized brain, it's really hard to do that because it's biology. So a lot of this is like that part of the brain is blocked. Therefore, it's hard to even be able to think like, oh, I should think about this. It's like you don't have the capacity in that moment to do that. Um, so that's why they kind of, phrase it as short circuiting. And then right here is a hand model about understanding the brain. So like survival brain, you have sensation, automatic functions, survival strategies, fight, flight, freeze, submit, and collapse. And then the second part is the emotional brain. So you have expression, regulation of feeling, memories, relationships, attachment. The amygdala is a smoke alarm. So that's when it tells us there's danger or a perceived threat. And then we have the thinking brain. So that's critical thinking, problem solving, planning, creativity, beliefs, impulse control. And then we have the offline brain. So this is our survival brain in control. So it's not able to access the thinking brain. So I know it's a lot of like biological stuff, but is there any questions about the traumatized brain or anything we kind of discussed yet? No? Okay. All right. And then more about the traumatized brain. So we have the amygdala. So the brain's emotional computer and alarm system. So what it does is it sets off our fight or flight in response to danger. And then we have our hippocampus, the brain storage for our most recent conscious memories. And what it does is it stores memories incorrectly and it affects memory retrieval. And then we have the hypothalamus, which releases hormones or cortisol to help manage and direct efforts to stressor. It's overactive, which leads to imbalances in hormone levels, can also increase stress and anxiety. And then we have the prefrontal cortex, where information is used to make decisions about cognitive and emotional responses. So the prefrontal cortex is difficulties in thought processing and decision making. So basically on the left-hand side is just saying like these functions of our brain generally are good, right? Like we need all of these parts, but in a traumatized brain on the right side, that's pretty much like where you notice sometimes how people function due to their trauma. And it's not conscious, it's not a choice, it's literally how their brain was wired and how they respond to things. What does chronic hyperarousal look like? So you'll notice hypervigilance, massive release of neurohormones, difficulties in self-soothing or de-escalation, intense or prolonged anxiety, irritability or aggression, and impulsivity. And then the effects of trauma, what survivors describe as sadness, loss, despair, depression, fear, anxiety, stress, terror, physical symptoms, concerns about children, loneliness, shame, isolation, confusion, guilt, substance use, loss of sense of self, insecurity about capabilities, and low self-worth. Obviously, there's probably hundreds more we could come up with, but this is just some of the general categories of what people describe. So kind of what I referred to earlier, this diagram right here pretty much describes two different brains. So on the left-hand side, we have a healthy brain, and on the right-hand side, we have an abused brain. So on the left-hand side, where you see all of the different areas being lit up, so like the PET scan is the brain of a normal child that shows regions of high, which is the red, and low, which is the blue and the black, activity. At birth, only primitive structures, such as the brainstem, which is the center, are fully functional. In regions like the temporal lobes, which is the top, early childhood experiences wire these circuits. So where they circle it on the left-hand side is the connections that our brain has makes. If this is like a healthy brain, we're assuming secure connection, unconditional love, emotional and physical safety. And then on the right-hand side is an abused brain, and this PET scan is of the brain of a Romanian orphan who was institutionalized shortly after birth. It shows the effects of extreme deprivation in infancy. The temporal lobes, which are at the top, regulate emotions and receive input from the senses. And such children suffer emotional and cognitive problems. So if you even just look at the two images of the brain, how different they look. And this right here is literally this is starting very early on, and when we don't have the connections in our brain, it's like we're not going to be able to think the same as if we were to have a healthy brain and have safety. So this can also cause a lot of the fight or flight or freeze responses earlier on. So then we also talk a lot about complex trauma at a woman's place. And when talking about complex trauma, we are talking about clients who have experienced multiple forms of trauma throughout the life cycle. Like, for example, many of our survivors and clients have had a history of childhood into adulthood and ongoing abuse. So it's domestic violence, sexual assault, physical violence, abandonment issues, kids that grew up in foster care, adoptions. Like there's so many different forms of trauma that we see with our clients and survivors. The results in a breakdown in the individual's capacity to process, integrate, categorize experiences, and regulate their internal states. So the difficulties and some of the observable effects is challenges in emotional regulation, activated by sight, sound, smells, or time of day, difficulty staying present or connected, difficulty comforting oneself, difficulty trusting oneself or others, difficulty in problem solving, taking initiative, making decisions, concentration and attention, disturbance in sleep or eating, forgetfulness, memory issues, physical complaints, and shame and self-blame. So just checking in to see if anyone had anything they would like to say or any questions or anything that anyone wants to share. It's okay if you don't. I just want to check in.
I was just wondering,
Yeah.
can that can those scans change if the trauma was early, or is it just irreparable? That kind of brain damage, I guess.
Definitely. So the good thing is it can change. So basically what you're seeing with those two brain scans is assuming there's no type of intervention. So no healthy relationships, no therapy, none of that stuff. But if you like if there's certain therapies, like obviously I'm a little biased because I do certain type of therapy, but there's other therapies. So but like EMDR, for example, helps to actually rewire the connections to the brain so that even if there was, let's say, childhood trauma or even a lifelong, let's say 20, 30, 40 years of trauma, that you can actually draw those connections to make it look similar to the healthy brain over time. So you actually can build that up. It's just a lot of times having this knowledge, it's like, okay, like if someone's like always forgetting appointments or, they're not texting back, it's like, okay, well, maybe that's a result of their trauma and not like they forgot about me. Because I think it's easy to like personalize things and like, we get annoyed with people. We're human. I mean, right? And it's like sometimes it's nice to be like, okay, like, all right. Like, and I know with clients, like I always, for me, for example, like I text every morning of the appointment and I was like, good morning, and whatever their name is. And I like to confirm our appointment. Number one, I like to know what's going on that day. It's nice to know my schedule too, make sure we're good. But also like maybe they forgot because life gets crazy. And, a week's a long time to remember an appointment if you have hundreds of other things on your plate. So this helps us to kind of understand like how we can approach these things with people too and be just patient and just like kind to them. Yeah. That was a great question though. And then there's multiple layers of trauma. So multi-abuse trauma is a term used when a person is impacted by several co-occurring issues that negatively affect safety, health, or well-being. So we do see this a lot with a lot of our survivors and our victims. If they might come in with sometimes all of these examples. It really depends on the situation. But sexual assault, childhood sexual abuse, child abuse, neglect, poverty, domestic violence, witnessing violence, substance use disorders, incarceration, homelessness, societal oppression, and intergenerational grief. And then this diagram just kind of shows a couple different things like abuse being, there's more, even more, it just doesn't fit on the slide, unfortunately, but like physical, emotional, sexual, mental, financial. There's so many different forms of abuse. So a lot of times when we have clients call, they'll say, well, they didn't hit me, or, I never called the cops. It wasn't physical. And we do a lot of psychoeducation around, it never has to become physical to be deemed as serious, to be deemed as domestic violence, to be deemed as abuse. So we talk a lot about the different forms of it because some of it is so subtle that it's like if you don't have the knowledge, how would you know it was abuse? We grow up in a society sometimes that it's like, well, if there isn't physical evidence of something, then it's almost like it didn't happen, even though we know it happened. And then with neglect, physical, emotional neglect, which could be from a primary caregiver, parent, could be a partner, could be anything, a friend. And then household dysfunction, so mental illness, incarcerated relative, mother treated violently, or father, or whatever parent, anyone in the house, substance abuse, divorce, separation, breakups. I'm obviously elaborating because this doesn't include everything. There's so much more categories that include that too. But I would say that the ones listed of these examples are things that we see pretty much I would say every day in our cases. So there's multiple layers of trauma. So there's co-occurring issues. So a survivor's situation may be further exacerbated by co-occurring barriers stemming from experiences such as poverty, medical issues, disabilities, or mental health concerns. So a lot of times when we're first meeting with someone, it could be an advocate, it could be our attorney. We have one attorney, it could be our attorney, counselor. We're assessing for basic need issues. So a lot of times we're trying to see like, okay, like, you know, do you have, heat in your home? Do you have a home? Do you need shelter? Do you have access to food, or is there food insecurity? Do you have diapers for your children? Do you, is this like the basic needs that we try to address first? Because it's like, if we can't address that first, how are we supposed to go into, deeper trauma work or even legal issues? So like, we definitely tried to make sure we help with that. Like, we have a food pantry at our counseling center in Doylestown. So, anyone that is a client, so as soon as you call our hotline, you're considered a client. So you didn't have to meet someone face to face, and you still qualify for, we help out with toiletries. We help out, we have the thrift store, which is amazing. And we can, help clothes. We have kids clothes, adult clothes, men's clothes, women's clothes, everyone's clothes, which is cool. So like, everyone can kind of, like, if you need, you want a new outfit, you're going to court, you want to feel presentable, we got you. Your kids are starting school, we help out with like school supplies. Just stuff that's like, if you don't have it, you need it, and it's expensive. So we always just try to like focus on whatever those co-occurring issues can be before we can really assess what else is going on. Also, societal abuse and oppression, so racism, classism, ableism, heterosexism, homophobia, any other form of discrimination, in addition to stigma surrounding issues such as substance use disorder or psychiatric illness. So a lot of times we also see this, like, when I started working here like 8 years ago, we had a woman call hotline, and she was in a same-sex relationship with another woman, and she wasn't sure. She's like, "Well, can I still call? Like, is this still like appropriate?" And it's like, "Yeah, of course." Like, and like, we helped her out. She was able to get to shelter, and I could cry, she really like made, like, she completely turned her life around. It was just amazing to see. And this is just an example of like, sometimes even domestic violence, it's always like, well, the men are the perpetrators and the women are the victims. Not the case at all. It's more like, it's just underreported among other, sometimes cultural groups, nationalities, religion is a big one. But also people that are in the LGBTQ plus community, certain people in different racial groups, it's not seen, it's not like accepted to reach out for help. So we try to, be as inclusive as we can, but also we have like a education team that goes out to a lot of these settings to try to say like, hey, like, we're here for you, and like, you don't have to self-disclose anything, but like, this is a resource if you ever need us, or if you know somebody that could benefit from our services. And then coping forms of abuse, so we have self-harm, substance use, may lead to further traumatic experiences, homelessness, incarceration. It may include development of long-term consequences for the individual's children as well. So I would say like suicide, I would put suicidality, suicidal thoughts, ideations as well. Just feeling like, why am I, like, this is a lot. Like, why am I keep going? Like, I just feel, you know, like sometimes the system or the court or, the PFA doesn't get approved, or it's just, there's a lot of things that go along with this. So I think a lot of our survivors, really, they're just trying to cope in the best way they know how, with the emotional resources they have. And there's also, like, I kind of always talk about this, but trauma from the system. People with multiple issues often face barriers to help. So, in most cases, if you don't have money and you don't have resources, how are you supposed to hire that lawyer, right, to represent you? Like, how can you fight for custody? Maybe you want custody because you don't feel like your kids are safe with the offending parent or caregiver. And a lot of times the clients that reach out to us, they might not have the financial resources because they've been financially abused in their marriage and their relationship for years. So but we try to connect them with, either we have one lawyer, so she's amazing, but she covers the entire county. So it's sometimes we try to offer like people that could do like pro bono, sliding scale, so they can still feel like they're represented without spending thousands of dollars that they really don't have. So does anyone have any questions about any of that, just layers of trauma or anything?
Sarah, I have a question. So,
Sure.
how do you deal with maybe an ongoing situation of self harm or substance use, while while they're seeking help? You also see them continuing those like habits? How does that work?
Sure. Yeah. So like just to give you an example, like sometimes I'll have clients that like they're like suicidal, there's like self-harm behavior, let's say like substance use, drug use. It's kind of like I still want to support them and be a support, but then I might also connect with their permission, of course, um, like a higher level of care. So for example, if I had a client that is extremely suicidal, has a plan, like, like I'm really worried for their safety, I might like talk like talk with maybe like going like an inpatient or intensive outpatient in the meantime, and I have no problem working with them like at the same time if it works. But if it's obviously too much and they can't commit, all these appointments, I'll say, do you want to go there first? And then as soon as you feel like you're a little bit more stable and you're getting the resources you need, then we can kind of continue our work together. But I really leave it up to the client, but I do have strong recommendations. Like if I feel like what they're needing is like more than like what we can provide in terms of like therapy, like an hour a week, right? Like won't be enough for someone that's like really like in the trenches with stuff like that.
Right, understood. Because I mean, I know like psychiatrists, psychologists, private practice, they'll sometimes have a staunch clause like if you're going to continue it, I'm not going to see you. But
Yeah.
it sounds like it's not that way.
Yeah, we're a little bit, I would say we're definitely more flexible. I think the exceptions would be um, like if someone were to come to like a meeting, for example, and they were like visibly like high or drunk or something, like that to me is a safety concern. I have to address it immediately versus like, like during the week, sometimes I like self-medicate with alcohol or drugs. Like then it gives me a little bit more room to recommend things. But when they're with me, they're in a space to be able to receive that kind of thing. That's kind
Right.
of,
Understood. Thank you.
yeah, sure. And then Brian, you had a question?
Yeah, it's related to what we were just talking about. And stop me if this is too far in the weeds of like the counseling side of things. Like,
There's no such thing. So go
there's
ahead.
also thinking like, some places do have that policy of like, oh, you didn't stay sober, back a line or whatever it is. What are from the counseling side? What are
Sure.
our policies for something like that?
Yeah, no, I think it's a great question because you definitely want to know it before you get into the session and you're like, now what, right? Like that's the worst feeling. So basically we kind of view it as like when you're dealing with trauma and you are a domestic violence victim or survivor, we kind of sometimes are already know that there's a good chance that there's going to be some comorbidity. So you're probably going that we might see some, self-harm, substance use, things like that. So normally what we have done, it definitely doesn't exclude them from services or counseling at all. I think what our policies kind of say with our intake that we go over with every client is that they're committing to being sober during the time they're with us. So like, for example, if we're on Zoom for an hour, they're meeting with a lawyer for an hour, they come in person, whatever it is, that like not only is it safety because I don't want you driving here if you're, intoxicated, like that's obviously this becomes more reportable at that point, but like if they say, yeah, like I got a DUI or I'm drinking or this and that, it doesn't exclude them from being a client because we know that's probably a way that they're self-medicating just to cope with what's going on. But we do offer the other resources for like drug and alcohol. But like if they don't go, it's not like we can't help them. But like if we feel that that's their primary concern and maybe it's not the domestic violence, then at that point it's like we wouldn't be able to help the way we would want to if they're not in the right frame of mind to receive it.
Yeah.
So
Okay, yeah, thank you. Makes a lot of sense. Like just kind of go with the safety, and if they have substance issues that aren't sort of something we can deal with, connect them with the resource.
exactly. Exactly. So like a lot of times people will connect to us primarily because of domestic violence, but then especially in therapy and counseling, it's like now we're like, oh, it's not this. It's a series of homelessness, drug or substance use, custody issues, legal issues go hand in hand as well. I feel like out of the clients I have, I would say 75 to 80% at least are in active, ongoing cases with their abuser in terms of custody, alimony, divorce, support, PFA stuff. So we tend to see them have a lot of different things going on. Sometimes it's like our job to be like, okay, what can we start with, and like we all kind of have so many departments, so like we all have our expertise in something, so But yeah, it's a good question because some places are like, if you don't do this by this, then like you kind of are excluded from our program kind of thing.
Thank you.
Sure, sure. Anyone else have any questions? No? Okay. I will continue. Just don't mind me fumbling around a little. Okay. Sorry, I skipped a slide and I don't want to do that. Okay. So the next one is the ACEs study. So what this is it's an adverse childhood experiences can impact health outcomes across the lifetime. So as the number of ACEs increases, so does the risk for negative health outcomes. So what this is a pyramid from conception to death. And 1 second, let me minimize this. Okay, so basically what it is sorry about that, guys. Okay, so the first one's generational embodiment, historical trauma. The next is social conditions, local context. The next one is adverse childhood experiences, disrupted neurodevelopment, social, emotional, and cognitive impairment, adoption of health risk behavior, disease, disability, and social problems, and early death. So what this study predicted is that the more, so you get like an ACEs score. So the higher ACEs score, the more health issues and mental health issues you have across time. So what they found with the study is that the higher ACEs score that you have, the more likely of like early death or chronic pain, any type of physical ailment. A lot of physical conditions also are really psychosomatic and are due to trauma. So that's what the study kind of went into to describe that better. Sorry, I had COVID a month ago, so I still like have this annoying cough, so don't mind me. Okay. So trauma can affect survivors' access and response to services. So willingness to reach out, engage, trust, mobilization of resources and decision making, responses to domestic violence, advocacy and supports, responses to law enforcement and testimony, and legal cases, appearance and demeanor in court. So basically, what this is saying is, depending on people's experiences, I mean, they might not reach out to us. They might not even trust anyone. So like, who are we to, we have to earn that trust and make sure that they know what they're getting into when they contact us, because it's terrifying. I mean, calling someone and not knowing who's on the other side of the phone and, divulging what's going on with you and maybe still living in that fear with that abuse and trying to find a quiet room to call and the other person's in the other room. Like, there's so many things that it takes time for us to really earn the trust of our survivors and our victims, because, we might honestly be the first safe person that they've ever talked to. And, when you're used to navigating unhealthy relationships and toxic people, healthy seems scary. It's like, I don't want to talk to you. Like, what makes me think I can trust you? So sometimes like people have called the hotline. They're like, I don't really want to give any information, but I just want to talk to someone. And that's fine. Like, obviously if we like set them up for therapy or legal or stuff like that, we have to have information. But just in terms of emotional support and you just want to contact the hotline to get information, you can be anonymous, and like we're okay with that because we know how hard it is to even make that phone call. So we like to respect our clients' autonomy, their confidentiality, and they can share as much or as little as they want, because we know it takes time to build trust and we're not trying to overstep or blur their boundaries or make them feel uncomfortable or that there's any type of agenda, because the only thing we have is we want to help. But we're very client-centered and empowerment based. So, we're really flexible with a lot of things because we understand how trauma works and how, people need to come to us on their own terms and with their own choice in their own time. So yeah, I think that's pretty much how we operate with that. I did have a video, and I think it's YouTube. It's a really good video about trauma. It's only about like 15, 16 minutes long. So if you guys don't mind, I was going to play that for us. And then after that, we can kind of talk about it and then get to some of the other slides, then a break. and then the second part. So if that sounds good, that's what I was gonna put on next. Okay. So this is, so what this is called is, oh, I have something in the chat. Hold on 1 second. Sorry. Okay. So sorry, let's see. How do you handle if an abuser calls in claiming they are abused, then the true victim calls? That is a good question, Mel, because it happens. It does happen. Sorry, I just saw this. So basically, it's really awkward and uncomfortable to say the least. Because I started off on hotline and I'm like new, I'm like panicking, I'm trying to get everyone to shelter and like trying to save the world and realize I can't, you know. But yeah, so if abuser calls, so basically we're on the headset, we're, you know, answering the phone. We have a system called ETO, right? So we're checking for conflict. So anytime someone calls, they're recorded in the system under their first or last name. And then there's like this feature called abuser inquiry, and we can type in the abuser's name to see if they are in fact an abuser in our system. If not, and there's, let's say we don't have that in our system, and they call and they, you know, lying basically, right? They're lying, saying that they're what we would do is we try to, if we can't have exact conflict and we don't know based on the system, what we'll do is we'll try to kind of ask some questions, pointed questions, because we, not saying we can't be manipulated, because we can, we're human, right? Like everyone can, because they're good at their, I mean, anyone that's experienced it or knows anyone knows that they know what to say. They know what to say. They know the key words. I mean, it's very premeditated, to say the least. So if they were to call and let's say they're like, oh, you know, blah, blah, I want this or that. Let's say they were hooked up with counseling or therapy or support groups, we would assess, and it's in our intake paperwork, if we do truly feel like they're a victim or are they really a perpetrator or narcissistic. And something's like setting off alarm bells for us that like it doesn't quite feel genuine. But yeah, it doesn't happen too often, but when it happens, we typically are able to address it pretty quickly and like not keep that person as a client. But hard to say the least. I always like to say that, I'm like, because therapists, you know, we're not like built-in lie detectors, you know what I mean? Like anyone has the ability, in my opinion, to be manipulated or misled. I mean, that's why I think in these situations, even victims and survivors are not always believed, because it's like, well, you know, they were the president of the school board and they were, you know, they're a great parent and they're the, you know, the neighbor that like got, you know, cuts the lawn for the other neighbor. It's like, yeah, from the outside, but like as soon as that door closes and they're inside, they're not that person. It's all about this image. So that was a good question, because I think we're very sensitive and we're like low-key detectives when it comes to that. So I hope I answer your question, but okay. All right, so I'm gonna start the video. So this is so it's how childhood trauma affects health across the lifetime. So it's by Nadine Burke Harris, and it's a TED Talk, which I personally love them. And it's about 16 minutes. So I'm just gonna put it on, we can watch it together and then talk about it when we're done. And just let me know if you guys didn't hear and everything's good once I put it in.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or pathogen chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California. And together, we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC. And together, they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you know, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. You seek the king, but you must first learn the discipline. Unlock the energy within. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, your multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across a lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real and this is all of us. I believe that we are the movement. Thank you.
Okay. Did anybody have any thoughts or anything about the video? Just kind of went over more details, obviously, of the ACEs study. I just thought it was interesting coming from like more of like the medical aspect of things, which is not my specialty. So, just any thoughts, concerns, questions, anything that resonated with anyone after seeing that?
I can share. I thought it was really, really powerful, and really relatable too. Just thinking of like my own growing up, and like I have two young kids, and like just how it's like such a big deal, and it is kind of crazy that it's not like in healthcare as much as she was saying that it should be. So I thought it was really, really pretty fantastic to watch.
Yeah, I'm glad you felt that way. It's like also like alarming, right? It's like the more information we gather, the more we're like, are we traumatized? Like are our kids traumatized? Like
Right.
and like, and it's not even like an intentional thing. It doesn't have to be malicious, right? Like it's, you know, it's all I always say like, give ourselves more grace because a lot of times when we're growing up, it's the first time we've ever been this age on April 4th at 5/11, right? Like it's not like we've done this life before. And I think we talk a lot of times with parents like that too. It's like, you may have grew up, in a traumatized environment and you're trying to break the cycle. And in a lot of ways, maybe you did, right? But it doesn't mean that that child doesn't have some type of trauma that maybe you can't protect them from just because like the other parent possibly, or just like school or other kids. Like there's a lot of like feelings of powerlessness, I think, when it comes to things like this too. Is there anyone else oh, hey, Maddie.
Sarah. First of all, thank you so much for doing this presentation. This is so wonderful and very informative. And that video that we just watched was once again, like the other members say, it was very powerful. One thing that just came to my mind is a question. So are in your facility, are there children's as well, like children, underage clients?
Yeah. So we actually do have, so I'll tell you the little loophole here. So yes, we do serve children. So basically it's like we call it like the emotional children's program, emotional support. The reason why is because legally, we can never see a minor without the consent from both parents that have custody. So, for example, we don't want obviously the offending parent or the perpetrator to know that they're getting services through a woman's place to protect the safety of the child, the other parent. So yes, so we can serve anyone under 18. So I would say even in shelter, for example, we've actually had like births at shelter, like, things like that. So anywhere from like, 0 to up to 17. And then once they hit 18, obviously they don't need consent from anyone and they would be able to work with any of our therapists and counselors. But yeah, we do have a children's program and normally they're seen in person. We have two offices. So there's one in Bristol by the historic Bristol Borough. And then there's another office in Doylestown as well. So the kids can be seen there and basically they would be brought by whatever the non-offending parent would be. That's who would be able to bring them.
Okay.
Oh, I see something in the chat. Okay.
Thank you, Sarah.
Sure, sure. Yep. And I can share, yeah, I can definitely share with you guys also the link to the TED Talk too, because I think it's helpful. I know like you guys obviously are interested in this stuff and learning this, and you're either trying to be a volunteer or work with us for a reason. And sometimes, like, I don't know about you, but when I learn new things, I'm like trying to play it for my family. I'm like, can you know some of this stuff? So I don't so you know what I mean? So like sometimes this stuff becomes like, especially as you start to work with clients, like common knowledge, but in a lot of ways, with a lot of people in our lives that we, encounter every day, they don't talk about these things. Like trauma is not even a topic of conversation. So I think, yeah, having resources to be like, hey, you got 16 minutes to view something that like I think everyone is impacted. I don't feel like any of us are exempt from the ACEs study. Just like she said, like, you know, most of us have at least one, but I would venture to say most of us have more than one. And that just kind of helps to like even like stuff like migraines, fibromyalgia, physical complaints of like physical tension, things that were, you know, doctors are like, well, yeah, it's probably just this. But if we look at this, it's like, well, you know, how much of this actually is a trauma response? You know, years of trauma, and like there's nothing actually, like it's not just a medical condition, right? I just think it's an interesting way to view things. Is there anyone else that had any questions or anything like that? Okay. Just have so many tabs open. It's like my brain sometimes. Okay, here we go. That's our second point, self-care, which is always a fun topic to discuss. Always fun. Hold on one second. Okay. So we'll just talk a little bit about we kind of had touched upon this before the video, just like obviously survivors access and response to services. We're trying to bridge the gap to like how can we reach people that aren't going to call, right? How are we, you know, going like so we'll put like pamphlets in bathrooms and hospitals, sometimes like rehab centers, just different places where it's like, okay, maybe like something where they can access our services on their own time frame that feels a little bit more private. So we try to do that as much as we can across the county. Okay. So how does understanding trauma and domestic violence improve advocacy services? So we can understand survivors' responses in context. We can respond in more helpful and empathetic ways. We can offer more effective interventions. We can better understand our own responses and their potential impact. And we can recognize the role of social context and coercive control. So strategies for healing and building resilience is the capacity for successful adaptation despite challenging circumstance. So the ability to bounce back from difficult circumstances. So what affects a person's resilience? So resilience factors growing up, resilience during early childhood trauma, social support interactions that are consistent and of quality. So obviously the little dragon and the, I'm not sure what that is, but so it's basically, it's a lot like, you know, people are like, oh, they're so resilient. You would never have known that anything ever happened to them. Which could be true, could not be true. Resiliency a lot of times also depends on the fact of like, you know, let's say I had an abusive parent growing up and you know, let's say they're narcissistic, you know, and my needs never mattered. I was always kind of caretaking for my parents. But I had one, like my other parent was loving and we had a secure attachment and I felt seen and I felt heard. My level of resiliency might be higher. So it's not that I'm not affected at all, but I might be affected less because I had, you know, a parent or it even could be a teacher, a therapist. It doesn't have to be someone related that's like, you know, fostering that type of love and support. So that can contribute to somebody's ability to have some type of resiliency. Resilience factor. So primary factor in resilience is having caring and supportive relationships within and outside of the family, relationships that create love and trust, provide role models, and offer encouragement and reassurance, help bolster a person's resilience. Sorry about that. Empowerment strategies can assist survivors in building resilience and skills for independence while strengthening self-confidence. So this is like the resilience wheel, for example. So like optimism, focusing on strengths, attitude to life. So focus on attention, kind of like that can-do attitude. Emotional awareness, key to good communication, control of self, your response to circumstances, organizational ability, social support, network of friends or family, sense of humor. This is one I use most of the time. Can laugh at life's frustrations, also known as technology, which we can all relate to. Self-belief, confident and have high self-esteem. And then ability to problem solve, willing to adapt and be flexible. Did anybody have any questions just about in terms of like resiliency or anything like that? No? Okay. So when talking with a survivor, get a drink of water. Hold on 1 second. So if anyone's thirsty, take care of yourself. I practice what I preach. Gotta practice it to teach it, you know? So when talking with a survivor, to foster resilience, we help the survivor to name the multiple, possibly conflicting feelings that they're experiencing surrounding the trauma. So for example, with this, it's like a lot of times we might have a client that come to us that's like still actively in the abusive relationship, and although it's like it's killing me, it's hurting me, I'm traumatized, but I still love them, I still care about them. And it's like, let's talk about the feelings, because your feelings are valid. There's not one feeling to have about um an abusive relationship. There's a lot of grief involved, there's a lot of, might be love on your end, care, you name it. So we talk a lot about conflicting feelings that they might be experiencing around ongoing trauma, past trauma, whatever that looks like. We also identify strengths that they have used to survive. What has got them to this point? What has got them to this point before they were, able to reach out to us? Like what helped them, like, and a lot of times they have a lot of courage, strength, overcome hurdles that is just really difficult. Um, Identify strategies that they have used to cope. We're talking like anything, right? Good, bad, the ugly, because we want to know like what have you used to cope, so we can see how can we best help you to make sure you're feeling good about your coping skills and your self-care practices. Um, Identify what soothes them. Identify social supports or networks, past or present. Um, Support the client in understanding that healing takes time, and reestablishing a sense of safety is the first step in healing from trauma. Um, so what I always say to my clients is, I know you want to be over this. I know you don't want to feel this. I know this is painful and it's hard. And it's like, unfortunately, it's like this trauma typically didn't happen overnight. So the healing is not going to happen instantly. So it's like the unwiring of the brain, drawing healthier connections, repairing a lot of damage from the brain. It takes a while. It's not impossible. I've seen it. It's happened, like, with therapy and different types of interventions. People have rewired their brains, the beliefs that they felt about themselves, the ability to trust themselves again. So this stuff can happen. I think it's like, you typically, when you're processing trauma, you feel worse before you feel better. And I always say that because I never want anyone to think that I'm working with or that works with us that like, now I feel worse, now what? And it's like, this is all part of it. So just letting them lean into the discomfort and know that we're there. We're the safe people that can be there for them, and it's okay. So creating trauma-informed services. So we have the foundations of trauma-informed care come to two different things. So we have commitment to trauma awareness and understanding the impact of historical trauma and oppression. So we have agencies demonstrate trauma-informed care with policies, procedures, and practices that do three things. So the first one is create a safe context through physical safety, emotional safety, trustworthiness, clear and consistent boundaries, transparency, and predictability. So even in our like physical offices and spaces, we try to make them a trauma-informed space. So like, what is a space that can make someone feel safe, welcome? Even like the colors of the wall, it's important to like be mindful of those things. Like my office is in Bristol. I work from my home office as well, but I like have like a beach theme, and like it's very like calming. And I use like a diffuser, and I like lavender and like relaxing things. And I think it just makes people not only feel welcome, but like I want them to feel like they're wanted there, and that there was intention and thought, behind this space, and it's not just an office to like sit in. So I think that we do that, I think, with the shelter as well. We try really hard to make it feel like home, and have paintings and new furniture, and we try to we've done a lot of remodels on it as well, just to make people feel like, you know what, like you might not be here for a while, but while you're here, like this is your home. Um, Also transparency and predictability. I am very transparent. I think as an organization, we are very predictable in terms of like we say like, well, this is what we can do and this is what we can't do. And this is, our intention and we want to help you. And we just try to show all of our cards so that clients can make an informed decision. And also this goes in terms of like staff volunteers. It's like you deserve to know all the information before you decide, like, do I want to be a part of this organization? So informed services goes for staff, volunteers, as well as our clients and survivors. Another water break. Second one is recognize and honor the individual through the relationship, respect, compassion, acceptance, non-judgment, mutuality, collaboration. Restore power through choice, empowerment, strengths, focus, and skill building. So a lot of this kind of highlights what we had talked to before about like if somebody has another condition or an addiction or mental health issue or suicidality, that we're trying to empower them to help them in the best way we can. So we're never going to rule them out because there's other things going on, because as we know with trauma, chances are they're not coming in for a single incident trauma. So there's probably ongoing trauma, prior trauma, and coping skills that they've developed over time, healthy or not, that we want to help them be able to, and like focus on their strengths. I mean, I think it's like, yeah, you might have unhealthy coping skills. Doesn't mean you don't have any strengths, like it could be the way you have survived. You might have been in survival mode for years, So we like to focus on that too. So that's kind of like the model we operate from as a whole, in terms of our agency. So was there any questions about that at all? Okay. Right. Okay. Creating trauma-informed services. So being trauma-informed requires viewing the person in the totality of their experiences, concentrate on understanding the trauma, someone that may have experienced over the course of a lifetime, and recognize and attend to the experiences that have informed the survivor's feelings, behaviors, reactions, and perspective. So kind of what we already discussed, like, understanding where they're coming from, like what, a lot of times in therapy, we do like a trauma timeline where it's like, okay, like, I know you might be coming to me for domestic violence, but I'm sure there's probably other things maybe you want to address and maybe draw some connections and heal from some other things. So we're just really peeling back the layers, but at the client's comfort level. And then integrate trauma-informed philosophy into organizational policies, procedures, and practices. So it involves asking questions, not focused on what is wrong with you, but rather what happened to you. How did you feel about that? What will help you feel safe? What can I do to help you? So we're very like cautious about the type of language that we use, um, primarily because we want to make sure that we're not victim blaming, even if we don't intend to. We want to make sure that we are, asking questions in the right way, because unfortunately, they survivors and victims and everything like that, they might have gone through other systems, law enforcement, potentially court system, judges, and they might have gotten asked, what is wrong with you or what happened, in a way that feels kind of accusatory. I'm not saying it's all the time, just obviously it happens enough to talk about. So I think we like to be mindful of our language to make our clients feel as safe as possible in a really scary situation, divulging their trauma to us. So a trauma-informed approach to domestic violence advocacy. So there's 5 core components. Providing survivors with information about the traumatic events of abuse, adapting programs and services to meet survivors' trauma and mental health related needs, creating opportunities for survivors to discuss their responses to trauma, offering resources and referrals to survivors, reflecting upon our own and our program's practices. So all survivors should have access to advocacy services in an environment that's inclusive, welcoming, destigmatizing, and non-re-traumatizing. So we're really mindful of, what kind of staff that we have, volunteers too. We could not have an agency without our volunteers and interns. Like, I really say that because it's really true. Nonprofit world, we need everyone. So I think we all go through, this training. So we're all on the same page. And, the people that are drawn to our agency tend to be the best people. I'm not gonna, they just are, they just get it. They get it, whether they have lived experience or they've been touched by trauma, or domestic violence in some way. So it's like, I honestly can say everyone that, works for our agency and all the volunteers that I've ever worked with or trained have been absolutely amazing. Um, and well, I'm happy that you guys are on board and getting started with us because I think you will love it. And these are some of our best practices. So we have safety, trust, choice, collaboration, empowerment, and access. So safety, emotional and physical, trust, confidentiality, choice, respect, collaboration, joint effort, empowerment, survivor-centered, access, resources, and services. Healing takes place within the context of a safe relationship between survivor and advocate, which is based on empathy and respect. Advocates have a responsibility to welcome the survivor's concerns if and when something happens in the program that does not make them feel safe. So for example, if we had a client who maybe like they don't feel safe in the shelter, or they don't feel safe with their therapist or advocate for whatever reason, we take that really seriously. And sometimes it's physical safety, like for example with residential, but maybe it's emotional safety. They don't feel comfortable, it's not a good fit. That we take that seriously, and it's like, okay, like if this person doesn't, work with you, like let's find someone that does. So we're really good at that. And like anything, it's like everyone's personality doesn't always jive well together, so I think we're pretty open and transparent about, hey, if this person doesn't work for you, we have a team of people that can help you and, better meet your needs. So remember, each individual seeking services has a unique history, background, and experience of victimization. The way survivors experience trauma and their reactions may be affected by their culture and identity. Strive to be self-aware of biases and judgments about the experiences of others, and educate yourself about the ways DV affects people of varying communities and identities. Avoid assumptions and treat each survivor as an individual. This obviously is very important, because we have people from all different, generations, genders, orientations, religious beliefs. Even with like religious trauma, which isn't necessarily talked about a lot, but we have a good amount of clients that were told, by spiritual leaders that divorce is a sin. You shouldn't get divorced. We don't support it, depending on what religion they're from, or the church, wherever it is, or feeling like, that they're supposed to stick it out. So we do deal a lot with religious trauma, being misled by different religious communities and feeling like, is it okay to reach out? Like, am I allowed to do this? Like, and really understanding, and respecting the religion they come from, but also being able to educate them on, their rights as a survivor or a victim of domestic violence. Did anybody have any questions regarding any of that stuff? Okay, so we have counseling services, I know we kind of touched upon in the beginning. So autonomy, options, empowerment. Community counseling services offers empowerment, counseling, safe options counseling, and crisis intervention to adults. And then, as we spoke about a little bit before, We also have children's advocacy services. So that offers a supportive service to children and their non-abusive caregiver or caregivers who have been impacted by DV in some way. So a lot of the children that we serve are children that have experienced domestic violence within, their parents were in domestic violence or they were around some type of family violence, and then they came to us. And a lot of times we'll work with the parent in individual counseling or therapy if they want that, or support group, and then we'll also work with the children, and then we work with them together. So we do a little bit of everything. Um, and we also have adult trauma therapy services, EMDR. So that's what I primarily do. It's me and one other therapist, and then we also have interns that we bring on, which really help out in being able to help our adult population. We also work with the older adult trauma therapy services, so anyone 60 or above. Um, so we have a lot of people in that age range too that reach out that sometimes have been in abusive relationships for 50, 40, 50 years, and they're looking to either leave or safety plan or get information about, what is this? Like, I know it doesn't feel right and I want to be happy. And we have people in, that age bracket as well. We have community support groups, and we have so two of them. I know I mentioned Braving before. That is basically, it's like a closed group. So we do like signups ahead of time. And then whoever signs up for it, I believe it's like a 9-week program. And then it's based on Brene Brown, who is a famous researcher and social worker. And it talks a lot about, like, empowerment and vulnerability, guilt, shame, and a lot about setting boundaries. And so that's one group we have. We've had that for the past, I want to say, like 3 or 4 years. And then Becoming You, we've had for a while. And what that is about, it's like, I guess the best way to put it is like a trauma course, but it's a support group. So there's still room for like discussion and stuff, but it's a lot more of like learning about trauma. And there's different topics each week that are presented. So with that, it's like a curriculum too. It's like a certain amount of weeks. And any client that wants to participate that can sign up for it. And then they have group facilitators that run both of the programs. So benefits of counseling and support groups. It's a safe place, a place to feel seen, heard, and valued, decrease isolation, normalization of symptoms, camaraderie and social support, connection, resources, information, validation and emotional support, education about DV and power and control dynamics, shared wisdom and experience. Additional healing methods. So ongoing trauma-focused psychotherapy, EMDR, which is eye movement, desensitization, and reprocessing therapy. Medications, if recommended by a medical professional. Holistic approaches, self-care, health and nutrition, exercise, self-help workbooks and strategies, yoga, meditation, spiritual community involvement, hobbies and supportive activities, and supportive relationships. So obviously I think it's a mixture of all these things. So, we talk a lot, like therapy is great, counseling is great, but sometimes, obviously self-care, which we'll get to a little bit later, is super important. But then also honoring like holistic approaches, maybe you don't want to be on medication. There's no right or wrong answer to that. It's definitely like an individual experience and what you feel like works best for you and your healing. So last question regarding this model. What was the most helpful piece of information we discussed today? So particularly this section, is there anything that kind of stood out for you? Something that kind of resonated with you at all?
I think just the pervasiveness of trauma that affects everyone. Really, that like the TED Talk again. I know I commented on it before, but that just really stuck with me.
Yeah, definitely. It makes it more relatable in a lot of ways too. I feel like that it's like it doesn't always have to be these extreme, because sometimes with trauma, people think it has to be like these extreme situations, like catastrophic, when it doesn't. It could be like I literally grew up in poverty and had, food insecurity, right? And like that's a major childhood trauma.
Yeah, yeah. And the way the TED Talk framed it, it makes it like kind of like she called it like a movement. So it's also energizing to think like, oh, we're gonna like start volunteering, and like that's exciting too. So
Yeah, definitely. Absolutely.
I would also add, like your modeling of a woman's places philosophy when it comes to clients, and sort of showing what it means to be client centered through your examples, and what you mean by how important you all feel it is to empower clients and to trust clients, and to sort of let them just choose how they want to be helped, was also really helpful.
Good. I'm glad. I mean, sometimes I'm always debating if it's too much self-disclosure or not, but I just feel like I know for me, I do really well with examples because I feel like sometimes it's like I'm not a science person, I'm a social science person. So when it gets so technical, I'm like, well, how can this apply to like what most of you are going to be doing, right? Whether that's working in any of our departments or volunteering, like you're going to be working amongst survivors and clients in some capacity. And I think this knowledge and examples can help just even if it's a different capacity.
Yeah, absolutely.
Does anybody else have anything else that they feel like was helpful or anything that they maybe didn't know and something newer?
Yeah, I never heard of the ACEs pyramid and all those layers. I want to go back and look at that more closely. Just
Yeah.
seems like a nice guide. I've never heard of that. And even the way like the TED Talk referred to it, it's like she uses that as a reference a lot in her, evaluations, I guess, or whatever. Yeah, that I never heard that before. That's interesting.
Yeah. Yeah, definitely. I feel like we always hear of like in terms of pyramids is like the Maslow hierarchy of needs, which is like the basic, basic needs and things like that. But like I think the ACEs score is like not as much common knowledge. I don't remember learning in school at all, honestly. And maybe I did, but I don't remember. So I feel like it's helpful to learn it now just to understand things from a different perspective. Yeah. Um, and then what is one thing you learned today? Well, I kind of already combined both questions, which is typically what I do. So, what is one thing you learned today that you did not know? So elaborating what I already asked, but is there anything else that kind of came up that maybe was newer, surprising, validating, anything?
One thing that I took a note while watching your listening to your training is how one of the like approach or like intervention that a therapist can use is helping the client to name the feelings as much as they can. It was actually the therapist naming the feelings for them, right? Yeah.
Like, what about like the conflicting feelings about trauma?
Conflicting feelings. Yes.
Yeah, so I would say normally, so I always let the client name the feelings. Like I would never name it for them. I'm more like, it sounds like there's conflicting feelings maybe about, I'm just giving an example, about the relationship, right? Like, like he or she or they, maybe, they did horrible things, but like you still love them. That's valid, right? Like I'm not gonna sit here and act like it's not a valid thing. So and like sometimes I'll even go over like, what are like there's like I love pyramids because they're like nice to see. I'm a visual learner. So like there's pyramids of like emotions, like the iceberg of like anger is a primary emotion, and then is it sadness and pain beneath it. So sometimes with clients that might have issues identifying emotions, I might bring out that. So it's like, oh, what ones kind of resonate with you based on like what we're talking about?
Okay. Okay.
I'm very person-centered, client-centered. I never want them. I always say, like, I'm not the expert. Like, you are the expert of you, right? Like, I don't know you better than you know yourself.
Mhm.
I'm basically here to help facilitate that process. and I want to be a safe person to help you with that. But I'm not going to sit here, give you advice or tell you what to do or anything that like a lot of therapists are kind of portrayed in the media where it's like we just like, yeah, and you should do this. We don't do that. We never do that. So, yeah.
I can see how that process can like help them to be more grounded because they gain that awareness of what's really going on emotionally. I thought that was really great.
And also, I think too, that's an important point because a lot of times it's like a lot of our clients are not able to speak freely to anyone in their life about the conflicting feelings because a lot of times I'll have clients who are like, yeah, but like I'm not ready to leave yet. Like I'm still, you know, invested. And I'm like, if you're not ready to leave, don't. Like it is that simple in terms of like I never want someone to think that they have to leave because that's what they're supposed to do. And I put in air quotes because there is no right or wrong here, right? I want to make you feel as safe as you can, maybe in an unsafe situation. So a lot of times with people when they're talking to their parents or family or friends, their friends are like, just leave them, just leave them, just leave her. Like, what are you doing? You know? And it's like, that's not very validating of the experience. This person might be with this person 20 years and they have kids and they don't want to disrupt their entire lives and their children's lives. And I think it's important for us to respect where they're at, meet them where they're at, and support them where they're at. So I think that kind of highlights what you were kind of saying, Maddie.
Okay, thank you.
Yeah, of course. Oh, Brian, you have your hand raised. What's going on?
Oh yeah, just like for something that I didn't know about really sort of I guess like there was mention of like the chronic pain and other physical symptoms that kind of go with exposure to trauma or or trauma over time and yeah I don't know it's just I want to be able to kind of like think about somatic symptoms like that a little bit
Yeah.
too as part of this constellation of other things, hyperarousal or what have you that might happen with somebody who's been through something.
Yeah, I think it's important, right, to like kind of look at it because a lot of times what you'll see is a lot of our clients have a lot of physical ailments or
My internet cut
COPD,
out.
fibromyalgia, there's a lot of different ones, and I've actually seen it where clients have been able to do a lot of work and then sometimes their symptoms dissipate to a point where it's like I don't have the same joint pain. I don't have high blood pressure anymore. I've even seen it with diabetes. Migraines is a big one. A lot of like IBS and like gut issues as well, kind of being resolved through healing and being in a safe space, like a safe environment. So it's interesting. It's like the mind and the body are so in tune, and sometimes we view them as separate entities, but they're like so interconnected. It's really crazy. Did anyone else have anything to add regarding that?
Well, Sarah, I'll just say I appreciated what your comments on how you deal with obviously people have situations and they don't just go away. And typically, when somebody's coming to you for help, they're probably not in the best mental state, maybe in the middle of addiction, things like that. So it was helpful that you explained the rationale of how you deal with that kind of situation because to be honest, I have to think it's more. It has to be rare that you have someone coming in who's not self abusing or using substances, and so it was good that you addressed that, so I understand it. Thank
Yeah.
you.
Yeah, of course, definitely. Yeah, I would agree. I definitely think it's a lot less in terms of not having other maybe self-harm or more like unhealthy coping skills and things like that or behaviors. And a lot of times like these people are coming to us, they want to change these things, but it's like they served the function for so long, so it's like still honoring, like I get why you did it, right? Like I'm not, there's no judgment here, so let's just see where you're at and see how we can help you to help heal a little bit. Like what does that look like?
Yeah, thank you very much.
Sure, you're welcome. Okay, we also have a message. So from Molly. So it's really refreshing to hear that our goal is to help the clients make their own decisions instead of pushing our idea of a solution on them. Absolutely. Yeah, I think we're definitely big on that. We're really big on just like, what does this individual person need, right? So there's no like blueprint. I always say there's no blueprint or like um template to help people because like everyone is so individual, right? So even if they're coming to us with a similar concerns, they're a different person. They have a different trauma history, they have a different way of dealing with stuff. So I think we're really sensitive to make sure we're like honoring them as an individual and not just like another case, another person, another, you know. And then we have one more question, and then we can take a break and eat a little dinner, whatever you guys got going on. So the last one would be, what more would you like to learn to help you to understand the impact of trauma on domestic violence survivors? Is there anything that kind of comes to mind?
One thing I think it was mentioned in the slide where you talked about a woman's place and what is done to like do trauma informed practice, but it was the idea of the collective trauma, like oppression and whatnot.
Hmm.
That'd be really interesting to learn
Yeah.
about and how that affects the individual trauma that the clients are experiencing.
Definitely. Yeah, I know like in a lot of social work programs they talk about more of like that collective trauma like in communities and what they endure and like how that contributes to individual trauma, whether that's like your neighborhood, different communities, different things like that. Yeah. Let's see what else we have going on here. Excuse me. That's okay. Just internet connections. So, okay. So in terms of taking a break, is everyone comfortable? Like, again, trauma informed asking, do you guys want a 10, 15-minute break? What are you guys thinking? What are you feeling? I know it's a lot. So you let me know what you're feeling and I'm good with it.
I'm thinking 15 just so we can grab something to eat, if that's okay.
That's totally fine. That's totally fine. So let's say, do you guys want to come back at like, we'll just like round, you want to do like 6:10, come back 6:10, and then we'll cover the rest of the material?
Sounds good.
Cool.
Perfect.
Yeah.
Awesome. So yeah, so what you can do is stay in here, you can just turn off your audio and camera, and then we'll just reconvene at 6:10. All right, enjoy your break. I'll see you in a little bit.
Sounds great. Thank you.
Welcome back. Hopefully everyone got a chance to eat a little something and get their energy for the next half of the training.
Yes, thank you.
Yeah, of course. Breaks are important. We all need them, you know? Okay. So I think everyone is back, hopefully. I'll wait another minute. Does this work for you guys if I do it like this so I can see you and not play around with the thing the whole time? Does this work for you guys? Okay. All right. All right. Just waiting for a couple more people to get back. Okay, I think I'm gonna start. So the next half is something we just did, self-care. It's my favorite topic to talk about because I feel like if we don't take care of ourselves, there's no way we can ever hold the space or take care of anyone else. And so obviously I love little images. I feel like they're always fun. But just a self-care checklist is obviously just covering the bare minimum right here, but like good sleep, meditation, exercise, reading a book, eating healthy, drink more water. Self-care and self-love kind of go hand in hand. So self-care doesn't have to be something drastic, it can be literally like drinking water, going for a walk, taking a nap when you're tired, going to bed, when you're tired, whether it's 9 p.m. or 7 p.m., right? Like that's all forms of, I feel like self-care and I feel like what's important. Aw, a cat. I love cats. I love them. Animals are welcome on the training because they should know about self-care too. So yeah, and just to give a little example of what we're gonna learn in this portion of the training is to better be able to understand the differences between stress, burnout, and secondary trauma, discuss the importance of self-care, and complete a self-care assessment and create a self-care plan, which we'll kind of get to in a little bit. Um, so yeah, so we're gonna just do that, talk a lot about self-care, what we do, what works, what doesn't, and just know the differences between some of these things. So how do we define stress, burnout, secondary trauma, and self-care? So this will go into detail more about each category here. But I think what's important to understand is when you're working in any caretaking profession, right? So it can be through agency work, it can be at a hospital, medical field. These things exist, right? So it's like, how can we talk about them and address them in a way where we recognize when we have signs of these things and we know, okay, I'm feeling a little burnout today. What can I do to help myself, right? And to have, honor how I'm feeling so I can show up the next day or the next week, feeling rejuvenated, feeling able to show up for people and myself. So stress. So stress is an expected human experience that occurs across many environments and situations. So coping with the feeling of being constantly asked to do more with less. So I don't know if this is relatable for anyone, but we tend to in life serve many roles. So we might be a partner, a daughter, a son, a child, a therapist, a lawyer, social worker, You know, like there's so many roles that we tend to play in life that sometimes it's like we want to give everything to everyone, but we just don't have it to give. Um, and it's not personal. It's just I always say like we only have the emotional bandwidth for a certain amount of things in the amount of hours that we're actually awake, right? So like in a day there's 24 hours, but we're not up for 24, well, we shouldn't be up for 24 hours. You know, so I think it's important to, you know, set boundaries and be able to understand like when we're feeling stress and what we need to do to alleviate that stress. So burnout can result from long-term unaddressed stress, a feeling of being exhausted, unmotivated. So sometimes, you know, in the field of therapy or social work, case management, um, it can happen, right? Like it's like, hey, you're one person and you have to have 35 people on your caseload, right? And that's like a lower end compared to maybe some other places. So, you know, that can lead to some burnout, right? And you know, sometimes it's, you know, if you have personal things going on and you also have professional responsibilities, sometimes it's hard to gauge like where's the something's got to give, right? I need more sleep, I need a vacation, I need to take time off. Like what can I do to help alleviate this burnout? And burnout, I think in most cases is pretty inevitable. So it's not that it's never going to happen, but it's being able to acknowledge when you are feeling like it's going to happen and what you can do. And can you get support from your supervisor? Can you get support from your family, your friends, people where you can feel like you actually can talk to about how you're feeling and not feeling shame or guilt about it because everyone experiences this. It's nothing bad. It's really just understanding how can I support myself and show myself compassion in moments of burnout. Secondary trauma. So this can overlap with stress and burnout. So it's a negative transformation in the self of a helper who engages empathetically with traumatized clients, also known as like vicarious trauma. So, for example, if you work with survivors and victims of domestic violence, there's some days where you could be hearing the worst of the worst in terms of like this is very traumatizing and like sometimes we just take it on, right? Like we're so empathetic, we want to be there for them and want to help them that like now we feel traumatized. um it's like day in and day out when you're working with trauma survivors. You know, it's kind of like, you know, obviously it's more intense when you're working with someone and it's like a real situation, but just like on a smaller scale, have you ever watched like a movie and it's super disturbing? You had no idea it was going to be that way. Like it's an unexpected, like disturbing movie. And then you find yourself after like in a whole different state of mind, like feeling like I thought this was a comedy and it turned out to be a psychological thriller with something crazy at the end and now I can't sleep. Um, it's kind of like obviously this is larger scale, but just to give like an everyday example of like how it can feel because it's like the things that we hear every day. It's like I know I do it. I'm like screaming for healthy people. Honestly, I'm thinking every relationship is toxic or unhealthy because I'm so used to seeing things in a certain way that like I'm hyper vigilant, hypersensitive to it in my personal life or just when I'm not working. It's hard to turn it off, is what I'm saying. Um, so these are just things to be aware of so we know how to help ourselves. And that's why self-care is so important. So, you know, like I'm a therapist 35 hours a week, right? That's my average. Sometimes it goes over, but after those hours are up, I am not a therapist anymore. Like I believe you have to work hard, but you have to play harder. And I say that all the time and it sounds funny and trivial, but I feel like it's like if I want to show up for my clients in the way that they need me and even other staff members and the people I supervise, then I need to be able to take care of myself so that I am getting the rest I need. I am getting the social connection. I'm eating, you know, I'm drinking water. I'm making sure that I'm good, you know, and I think that's important when you're in any setting, but especially when you're working in a population like this. Did anyone have anything to add or any questions, comments, anything like that so far? Okay. So the next one is, so what are some signs of secondary trauma? So what that can be is it's specific symptoms that really parallel PTSD. So you might have intrusive mental images, anxiety, paranoia, despair, hopelessness, feelings of guilt and shame, sleep and appetite disruption, cynicism, hostility, agitation, withdrawal from family and friends, difficulty in maintaining helping relationships. Um, so a lot of this is symptoms that pretty much outline what PTSD, post-traumatic stress disorder, appears in people that it might actually happen to them. But through secondary trauma, we can experience the same symptoms. So what you might find sometimes is after your direct service training, you might not have any more capacity to listen to anyone else. Like that's just real. You might be like, I need to like unwind and mindlessly watch TV that has nothing to do with trauma, domestic violence, or anything that I have to pay attention to. And like animals, big proponent of animals. I think they are amazing and they don't require us to have a full conversation with them, and they don't talk back. Well, they meow and bark and stuff, but they're really healing in a lot of ways. And I feel like that's a great way to practice self-care is engaging, with animals if you love animals. Doing things like that doesn't require a lot from you, especially when you're giving all of your energy to people all day, right? So whether you're volunteering or you're a staff member, no matter what it is, you're still giving a lot of yourself to other people. And something that I always like to talk about, which I think is important, is you might find it's hard to be there for people in your personal life when you've heard the most severe stories of trauma all day. That sometimes it's hard when you have, let's say a friend calls you or someone, they're like, can you believe that like there was like a traffic jam on 95? Like you might not have the capacity to really offer much empathy and validation, but you might have, maybe on a Saturday you're off, you can, right? But during the week, you're kind of like, I just heard like really like traumatic things that are like life altering, that although the traffic on 95, which we all know is always a headache and a nightmare, it's always under construction, we don't have the emotional bandwidth sometimes to offer those same skills to people in our personal life when we're giving so much to people that really are in the trenches of trauma. And sometimes, yeah, you might notice like hostility, agitation, irritability, because it's hard not to take on some of the things that our clients might present with because we're empaths. That's why we're here, right? We must be empaths if we're interested in this organization and organizations like this. So sometimes it's like I need to isolate a little bit. I need a little alone time. You might find yourself a little bit more irritable than usual, not uncommon. And it's just looking at this as a framework to understand like this is normal. This happens, and it doesn't mean you're always going to be in this state at all. It's just recognizing, okay, when I'm starting to feel some of these things, maybe I need to look at my self-care. Maybe I need to see what I need to do more of, or what do I need to change some of my habits. Maybe they're not working anymore. I also think self-care works in the sense of like what worked for you yesterday might not work for you tomorrow. So to me, it's always about having a lot of self-care practices because for example, someone's like, oh, reading really worked for me, but like today I cannot focus. I sat at a computer for 10 hours or whatever it was. I need to do something physical because I can't mentally sit, right? So it's having a lot of different things that could engage in different parts of your brain where you don't feel exhausted. So then we're comparing some of these other things. So like stress versus burnout versus secondary trauma. So stress and burnout mitigated, resolved in the workplace by time off, support, encouragement, professional training. Secondary trauma also mitigated by these strategies, but requires other more intensive efforts to target it specifically. So, for example, stress and burnout more is like the beginning stages of stuff. So with that, it's like, I have some paid time off. Maybe it's time I take a little vacation or a staycation. Like maybe I need to like not be on the computer, not see anybody, and just like be, laying on the couch with my four animals and having a, relaxing night, right? Like that, maybe that's what I need. Maybe that's what you need. And then secondary trauma is like, okay, so now it's like that deeper level of like, okay, so maybe now that's not enough because I haven't done that for a while. I haven't taken care of myself. So now it's like, okay, more intensive efforts could be now I really feel like I need my own therapy. And I think that, I mean, obviously, I think that's important for anyone, right? Like as a therapist, I feel like it's important for me to engage in my own work. Not only to understand what it's like to be on the other side of things, but to understand like what I bring, right? What are my stuff? What are my triggers? What are things that I'm bringing, to work, right? Like no one's perfect. So that might be, your own therapy, spiritual retreats, healing retreats, um, holistic approaches to things. Like it might take a little bit more than that time off or, a training about this to resolve it, is basically what it's saying. Um, and then just in terms of self-care, um, I mean, I think we hear it a lot, but I think it's always like, well, it's exercising. But like, what if you hate exercising? That's not helpful. It's not self-care to you, right? So to me, it's like very personal. So it's like self-care could be like, I like to lounge in my backyard in a hammock. Guess what? That's self-care. That's great. Like that's awesome. Any experience that brings your nervous system down, that makes you feel calm, that gives you a sense of rejuvenation, that makes you feel like you're not in that hyper arousal state, can be self-care. So, just to give some examples, like for me, self-care would be anything that involves animals, I'm doing it. So I love animals. Over the summer, like it seems like it wouldn't be self-care because it was stressful, but it was self-care. I rescued a pregnant kitten from the street. I didn't know it was pregnant, and I brought it in, and then she had 5 babies on my couch. And, so then I went from and I rent, by the way, so I had to hide them all, which was hilarious. But I went from I only had 2 cats to 9 in a matter of a month, and it was wild and crazy, but I regret nothing. And I ended up keeping one of the kittens because it didn't work out with the family, and they gave the kitten back, and I was like, yeah, what's another cat? I already have 2 and a dog, it's fine. Um, and it just, it made me if it felt like self-care because not only was I caretaking for something that brings me joy, but it wasn't the same as caretaking for clients all the time or caretaking for family, or it just felt different. Um, Nature walks, hiking is great. I love that. Camping, like, I mean, honestly, taking time off, like earning that time, taking it off, and not giving yourself permission to relax. Because I don't know if this resonates with anyone, but a lot of times people say, I had a lazy day today. I watched TV, I didn't shower, and I stayed in my pajamas. And I'm like, that sounds like it was an awesome day. Okay. So that sounds like a day where you literally just like needed to recharge. So like I even reframe it like that's a recovery day, right? Like why are we not entitled to not wake up, get dressed, do what you have to do? Why is that not okay, right? And I think it's societal pressure, the way sometimes our parents grew up, what we've been conditioned to think, that like relaxation has to be, met with, was super productive and now I can relax. When what if you woke up and you were like, guess what? I'm not leaving the house today because I don't feel like it. And like that's okay. And I think giving yourself that permission, because a lot of us, me included, we sometimes we tend to like judge ourselves a little too hard and be like, oh well, you don't want to be lazy, and like that's not lazy. Taking the L word out of the vocabulary, I think is really helpful. So that's just some examples. And then prevention's possible. So for the purpose of this module, we will focus on preventing burnout, secondary trauma through promoting self-care. So again, just like if we really are proponents of self-care and we make it a priority, just like we make everything else a priority, chances are we're not going to experience this nearly as much and it's not going to be as intense. So, importance of self-care. So, essential for one's own well-being, mental health, physical health, sense of purpose, professional fulfillment, excuse me, work-life balance, world outlook. And I think this is important too, because I don't know if this resonates with anyone or if you've been told this, but self-care isn't selfish. It's not. Being selfish is, it's being selfish is like number one, more like malicious, self-centered. I don't care about anyone else, not having empathy, versus self-care is kind of like, let's say your friend calls you and they're like, do you want to go to dinner tonight? And you're like barely getting through the day because you're exhausted, right? Like you want to veg out on some Netflix. And I always say pajamas because I think I'm like projecting. I love pajamas. Okay. So you put the pajamas on, you're watching that, and like that's what you truly want to do that night. So it's like saying yes to that friend really ultimately could be saying no to yourself, right? Like my needs don't matter. Your needs matter more and your wants matter more than my own, right? So that's not being selfish, it's being like, hey, like it was a question, which means I actually have the ability to answer yes or no, or maybe not tonight, maybe in a couple days, tomorrow, the weekend, like whatever that is. Um, but I think sometimes we're inclined to say yes to things because sometimes it's been modeled by our parents, right? Like, the overachiever, or you got certain accolades for getting all A's, right? Or going above and beyond, or it starts early, right? Like it's even like if you think about how like a typical school system is set up, right? Like when we went to school, and like everything's so numerical, right? So you fit into this box and you do this and you do that. There's no like gray area here, right? Like I'm not talking about like newer age progressive schools. I'm talking about like I went to Catholic school, little self-disclosure. There wasn't much room for questions. So it was like you do this, you do that, you do this, and then this is the result, right? So not only were you based on performance, but then sometimes when you go home, it's like given your situation, you might be treated differently based on what that report card or what that test grade says. So it's like we've learned from a very young age sometimes that our value is dependent on what we score or how well we do, which really is like tests are not accurate in terms of how smart we are. We have different forms of intelligence, right? But just to say like self-care, I don't know if anyone can relate to this, but I don't think self-care was ever taught in school. I never learned it. Life skills, never learned it. I learned algebra, geometry, and things I don't remember. But I don't ever remember learning like basic stuff. It sounds basic, but you don't learn these things. So like as adults, or if you get into this field, it's like, oh, so now we have some like terms for like what this is. And maybe I should learn to practice it because it's not selfish, it's not self-centered, and it's not malicious. It's actually needed to be able to function and not be a people pleaser essentially. Because it's like, no, I'm not doing dinner tonight, I'll catch you on another night. And like feeling completely okay with that. So I know I went on a little tangent about that, but just trying to give some examples to bring it to life a little bit. Does anybody have anything they would like to add or anything that they find is helpful for them for self-care or ways they've learned about self-care?
Well, I just know, I just happen to have me and my best friend. We just say, I've been hibernating. Like, I need to hibernate today. And we just know what that means to each other.
Love it.
Or we'll get to the point where if you have somebody you can like understands, then be like, I've been hibernating for like 2 days. I gotta get myself motivated. And we can understand each other. And like that helps. And I don't know, my daughter's on the spectrum, the autism spectrum on the high end. I don't know if I'd ever taught her this, but like if her friends want to go out, she already knows that I need to recharge my social battery, she said. And I never taught her that phrase. Like, I think maybe she learned it in school as coping. Like maybe
Yeah.
get more aware of that now. And so she knows, like, she plans her weekend. Like, if I go out Friday, Saturday, I'm not going to go out. Like, she plans it out ahead of time. So I think it's a little more aware, but it helps if you have somebody who understands, hibernation days.
Right. Right, exactly. And I think it's great to have like a friend too that like, yeah, it's like all you have to say is I've been hibernating. There's no like having to explain or justify. It's like, oh, I got you. Like, yeah, you're good. Like you need me to motivate you to get to like hang out today, or like you good. Like it's another day to like relax, Like, yeah.
Right. Or I just can't do anything today. I'm sorry. And that's it.
And like no feelings are hurt. It's like just
Yeah.
like a common understanding of it. Yeah. And then I think too with like your daughter, like that's super self-aware. And really, I mean, I think now probably the schools are like more or less like teaching some of these things, which I'm really happy about because like if we learned this when we were younger, like this would feel like second nature to us. This would feel probably more automatic than it does, because it's like newer concepts in terms of like what does it actually look like, like what does self-care look like, especially when you're like pulled in like all these directions, and it's like I can't do all this. Like this is way too much. Like I need to say no to something, right? Like if I keep saying yes, I'm going to be exhausted and I'm not going to be able to function tomorrow. Yeah, I love that though. I think that's great examples of self-care and your daughter's on to something. So she really is. The social battery thing I do hear a lot of times from the younger generation, and they're a lot more aware of like being an introvert, ambivert, extrovert, and like what they need to like feel like they can recharge for like the next social outing, even if it's like a week from now, or like what that looks like. Does anybody else have anything they would like to add, or anything that resonated with anybody?
One thing that it doesn't sound like like a self-care. It's not like, one of these take a day when you need a day kind of things. It's like meal hacks, basically, like doing something that makes it easier to just like feed yourself every day because that can be a hassle, like takes time, takes effort. So,
Totally.
like I have like a batch breakfast that I can make on Sunday night real quick. And then I don't have to think about it in the morning. I just like put some coffee in the machine and eat. And it just makes my morning like a little bit less stressful and keeps it from piling up?
Exactly. That's self-care too, right? Like literally like I know they're trying to ban TikTok, which I have mixed feelings about, but I like TikTok for things like that in terms of like quick meals in less than like 20 minutes, even quicker than Rachel Ray, which was 30 minutes. Sometimes I don't have 30 minutes to give mentally, right? So like having those quick meals like during the week or Sunday night and you're like, I don't feel like doing all this. I don't want to do a lot of meal prep. I know I should, but I sure as hell don't feel like it, right? And like having those readily available meals is like really like self-love, right? Because you're like, I deserve to eat well, but I don't have to slay myself in the kitchen for hours. Like that's not maybe realistic for me. And then other days you're like, you know what? I want to make this new recipe because I'm feeling creative, right? But like it's a choice. It's not like a chore. Yeah. I think that's super important. Because yeah, self-care can seem like so basic, but it's like if we're not intentional about it, it's the first thing that typically goes out the window when we're dealing with a crisis, when we're overwhelmed at work, when we're dealing with major life issues, whether it's like breakups or death or grief, like self-care typically is the first thing that goes because it's like, oh, we'll get to us. It's like, but we need to get to us now before we experience burnout, trauma, like all of these other things. Um, yeah, it's very important. Is there anybody else that had anything to add or wanted to share about self-care or anything that they feel like has worked, doesn't work? It's okay if you don't. There's no pressure here. There's no grade here. It's all good. Okay. Um, so importance of self-care. So also essential to relationships, organizations, systems, networks. One is a part of necessary in order to establish healthy boundaries, communication, productivity, effectiveness, support and collaboration. So obviously I only can really speak for like what we do here, but I will honestly say this is probably the first place I've ever worked that actually practices self-care. And I know that's sad to say, but I've worked in other areas in with trauma therapy that there was no self-care. So I was the unicorn, right? Like, what's this new person thinking they could go take a lunch break? And I'm like, yeah, that's what I'm entitled to. Like, I'm allowed to take a lunch break. I'm allowed to take care of myself, right? And like I feel like here it's like we so much promote like take breaks, when we do trainings, when we're with clients, like there is no power through the day without eating. Like I wouldn't be able to function. I don't know who would show up tonight if I didn't eat, you know what I mean? Like an empty robot or something. So it's like we talk about this in terms of training, but I think as staff and volunteers and interns and everyone, we really do model this. And I think that's really helpful, especially to see with coworkers and in leadership positions. It's like, well, if my supervisor is modeling self-care, then it's like it gives me automatic permission to take care of myself because I'm like, oh, like I don't have to like advocate for self-care. Like it's already built into like what the expectation is that I'm going to take a break. I'm going to check my emails not at 8 a.m. because I don't function that early. You know what I mean? So I just think that's important to be in like a workplace that supports self-care. Because it's really hard when you're the only one that does. You're seen as a slacker. And not all settings, right? Like it's not all settings don't practice this. I just personally have never experienced it before coming here. So that's just my own experience. Has anyone ever had similar experiences where like they've been in like a school setting or a professional setting and felt like they couldn't like take care of themselves properly? Yeah. It's a horrible feeling, honestly. Where I've done trainings, like been a participant of a training, and I was like, am I allowed to like eat during the training, or like can I like you know what I mean? Like it sounds so simple, but like it's like we have staff meetings and like we like have breakfast. Like, you know what I mean? Like it's just so normalized that like we're not in this like formal setting where everyone has to just like pay attention. Like you can still pay attention and like eat a bagel. Like both can exist, you know. Um, and then obviously just getting more talking more about boundaries is, when we excuse me, I don't even know what that says. I'm like having a hard time. It says when we own our capes. The writing's messing me up. But when we and swoop in with unsolicited advice and try to fix someone, we're infringing on their boundaries and potentially stealing an opportunity for growth, self-fulfillment, or their sense of accomplishment. It usually comes from the noblest and kindest of places. That doesn't mean that it's the noblest and kindest of things to do. So we talk a lot about boundaries with clients, coworkers, ourselves, because sometimes when you're newer to working with people, survivors, it's like you want to come in with your cape and you're trying to save this person. Like you're trying to stop domestic violence, right? Like you want to end it. You want to, and you have the purest intentions. Like there's no maliciousness here. Like it's not mean spirited, but inadvertently, it's a lot of times taking the autonomy away from our clients that need to make decisions for themselves and feel like we're just there to support them, right? So I mean, I give a lot of personal examples because I've been with the agency a while, and I just like laugh to like look where I was 8 years ago. So I started on hotline, and so just doing like a lot of the intake calls and crisis stuff. Never worked in domestic violence ever in my life, right? And here I am answering a hotline, working at the shelter, like literally screening people for bringing them in, put them in my car. I was like I was like, I don't know what I'm doing. Like, this is crazy. And I remember we have a smaller shelter. So unfortunately there's only one shelter per county for domestic violence, which is not nearly enough for unfortunately the demand that we have amongst other counties. So someone would call and we might be full. And like I felt so uncomfortable not like figuring something out. I was trying to fix their problem, right? I was trying to create a room that wasn't available. I was trying to do things that I could not do. And I think a lot of us get to this field because we want to fix, right? We want to help, we want to solve, we want to do all these things. But then we have to realize kind of where our limitations are and where do our personal and professional boundaries lie. And I bring that example up because I'm definitely not that way now. I don't think I would last that long if I was still trying to come in and save the world, right? But I think it's easy to fall into that pattern, especially when it's like newer, right? Like the first time you hear someone's trauma story, you're like, wow, that was heavy. Like, what do I do with all this now? Like, you just told me everything, right? Like maybe in an hour, 2 hours, whatever a session is. What do I do with all this? Like it's heavy, right? So I think self-care, having professional boundaries, also being like, okay, where are my limitations? Where are my strengths? Where's my role in all of this, right? What can I do to help? But I can't fix it, right? I can't fix anything. And then importance of self-care. So creating a self-care routine, being proud of your form of self-care. Self-care is not always easy. It can be doing things that are really uncomfortable. So things to me like self-care is uncomfortable could be like going out of your comfort zone to do something you never normally would do, and then you do it and you're like, didn't really think I'd be into something like this, but it really did help me. So for example, like someone that like is not really like identify as someone who's like into art or like being creative, but they're like they did like, they did like an art class and they're like, that really surprised me because I hate art or whatever, right? Like sometimes we stumble upon things that we didn't realize could be self-care or something we normally would go to, and then it turns out to be something we kind of develop as a coping skill. And then we kind of touched upon this, acknowledging the basic stuff, right? So having a glass of water, taking medication, going to the bathroom. I know it sounds trivial, but like sometimes when you're in back-to-back meetings all day, or you're just going, you're in that like zone, like sometimes it's like, have I gone to the bathroom today? Have I drank water? No wonder my head hurts. I didn't drink no water today. And doing that self check-in to be like, have I taken care of myself today? And not, yeah, and like not just focusing on like the big things, but like, did I eat breakfast? If you're a breakfast person, right? This is individual still, right? I know me, if I don't eat breakfast and the coffee, don't want to start work yet. Need that first, I know that about myself. So it's like knowing what works for you, what makes you feel like you can show up for yourself first and then show up for other people second, right? So you are always first and everyone else has to come second in terms of being able to show up professionally and feeling like you're in a good place too. Um, and I think this one's a big one because I think we tend to compare ourselves to others naturally because we're human. Don't judge yourself based off of others' coping strategies. So I think we do live in a culture, especially I think social media kind of can perpetuate this, where we tend to think that there's a certain way to cope. There's a certain way to take care of yourself, right? This is what you're supposed to do, right? We have a lot of people on different platforms of social media telling people this is what you're supposed to do and these are the coping skills. No, there is no such thing. Coping skills are individualized, they change over time, they evolve. Sometimes the coping skills that you had a year ago really are not what you want to go to now, right? Like as we discover ourselves, as we are on our own healing journey, also, the coping skills change, just like our hobbies change, relationships can change, interests can change. Everything's subject to change. So I think it's important. And we might even have friends who are like, I don't know if anyone can relate to this, but like having friends that are like morning people and you're just not one of them. And they want to wake up and go on a hike at 8 a.m. and you're like, I'll see you at noon. My coping skill is number one, setting boundaries. I still like to walk, but I'm not walking that early. It's just not going to happen. They know they don't ask me anymore. But it's like setting boundaries, but also not feeling bad about yourself because that doesn't work for you. It's like it's an individual preference and skill. So can anyone relate to even feeling like they sometimes judge their coping skills or like the way they take care of themselves compared to other people, or even compared to what maybe you used to do versus what you do now? Does any of that come to mind?
I think acknowledging the basic stuff is like really important, especially I'm the mother of two young kids. So like literally I will be like, if I just showered for the day, then like that's one thing I accomplished. Like it's like a big thing. Or just like remembering to drink water or feed myself can be, it sounds so simple, but like that's like truly self-care, and it's important, you know, it's not just like going to the spa. It's these
Right.
little things.
Right. And I think that's important, right? So when you're in a caregiver, position where it's like you're taking care of two small children, it's like if I don't drink water and hydrate myself, or if I don't take a shower, like I don't feel good, right? Like I don't feel like I took care of myself. And although it's like seems small, it's actually huge, because when we don't do it, we feel like the master effect of it, right? Um, so I think that's really important, but I think you're right. I think a lot of times it's demonstrated like, oh, it's a day at the spa, it's going on a plane on a vacation, and like these things sound great, but these things also cost money and planning, right? So what happens if it's a random Wednesday and I'm feeling exhausted? I can't go do any of those things, right? I need something I can rely on right now. So drinking water, getting a shower maybe when they're taking a nap or it's bedtime, right? Like that's more doable than some of these bigger, larger scale ways that we can take care of ourselves. Yeah, absolutely. Does anyone else have anything that they want to say? Anything resonate with anyone, or anything come to mind? As we're talking, I'm drinking the water, COVID cough, man. Don't have it anymore, but the long-term COVID, I don't know if anyone can relate. First. Okay. So I like this too. This says, so do the best you can in this given moment and know that is enough. So I think the example, like literally, and again, sounds simple, but waking up, right? I made the bed today. That is productive. I took care of myself because I feel good about it. Maybe I got a shower, I got dressed, and like maybe that is it, right? That is all I did today. But eventually, sometimes that comes as a routine. And now my self-care routine, it's easier to build upon when it's not so huge, right? Like if you like had a spa day and you got a massage and you got a facial and you had this like exquisite day, like is that sustainable every day? Not for us, maybe the Kardashians or someone, but not for normal like everyday working people, right? So it's like how can we have days maybe like that to look forward to sometimes, but how can we take care of ourselves where it just feels a little bit more realistic, a little bit more obtainable? Excuse me. Let's see. Okay, so we have some technical issue. Let me see. Okay. So from Molly, so I fully agree that my definition of self-care has changed a lot since becoming a parent. If I'm eating vegetables and drinking water on a daily basis, I consider that a win. Absolutely. Absolutely. It's like I can imagine after going through a major life change, which would going from not being a parent to being a parent, it's like all the free time that you once had is not yours anymore. So it's like, wait, I had all this time to take care of myself, and now I am rolling out of bed and taking care and feeding the child and doing this, doing all these things. I'm like, so I can understand like it can be hard for all that stuff to fall to the wayside. So I think, yeah, eating well, eating things you like, fueling your body, drinking water, getting a shower. This is all ways to show yourself love and that you matter. Especially in times where other people, which I think most of us can probably relate, other people rely on us in some capacity, right? Physically, emotionally, it's like it's not just us, right? Even if it's animals, right? If you don't feed your cats in the morning, good luck to you. It's not safe, They will protest against you because there's more of them than of you. Just saying. I have 3 of them. They tend to get mad if I don't like wait. Like, if they see one eye open, they think it's time for breakfast. So it's like they matter before I matter, you know? So definitely it can be challenging to manage self-care sometimes. But I think, you know, viewing it like this opens up the conversation, but also realizes maybe there's more self-care you practice that you didn't even categorize as self-care before. Okay, hold on one second. Okay. So then Brian wrote, we talk about self-care as what we do, but sometimes it's choosing what not to do. That's true. Will anything bad happen if the dishes sit overnight? Maybe it's okay to skip them so we can rest. We can also decide which chores to do kind of okay instead of really, really well. Absolutely. Absolutely. I think that's a great point. I think self-care also is, yeah, like being like, okay, so maybe, yes, last week I mopped and swept and got this like burst of energy that maybe was due to Starbucks espresso, right? Who knows? Maybe a personal example. This week, you have less energy and you're just like, you know what I'm going to do? I'm going to fold the blanket on the couch and I'm going to wipe down the table. And that's all I'm doing today. I'm not doing the whole like deep clean. And like, that's enough, right? Like, that's what I have the physical, emotional, mental capacity today, and not feeling like you're being lazy or you're not being good enough. It's like, no, like some days you're just not gonna you're not gonna have it, right? And sometimes it's hard to show ourselves that self-compassion. But if other person were to say that, normally it's like, oh, don't worry about it. The dishes, I mean, whatever, right? If they stay in the sink overnight and I handle them tomorrow, is it going to alter my life in any way? Probably not. But if it causes you more anxiety, that's a different conversation, right? Because there's some people where that would cause them more anxiety. But if it doesn't, it's okay. So that's this, I think, an example. And I think that's a great example you brought up because I do think we don't focus on that enough with self-care, like what not to do. Like don't over function when you don't have it in you. It's okay just to like be here. You're still adequate. You're still enough, even if you didn't go over the top with your household chores and what you normally do. Absolutely. So then, excuse me, the next example is self-disclosure. So when an advocate shares their own experience with a client with the purposes of improving the client's emotional or mental state, should be done solely for the purpose of helping the client and not to meet the needs of the advocate. Self-disclosure is the process of making oneself known to others. So for me, I do this with my clients when I think it's going to make them feel either more connected to me or it just makes things make more sense, right? Like I'm not doing it even in this training to meet my own needs. I'm doing it to make more sense because sometimes like you can learn definitions, but like what are some real life examples of this, right? So like in therapy, for example, you know, therapists would disclose things about their own experiences if they feel like that could be healing for the client that they're working with. And this is true in other aspects. Of the agency, whether you're in the thrift store, you're in PFA court, criminal court, you're a lawyer, like any of those ways, it can be helpful because it's like, wait, so this person helping me, like they have some lived experience, like they can kind of understand where I'm coming from. They're not just like reading, you know, out of a textbook or something they learned in school. And I don't know if anyone has experience with this, but I think you can tell the difference, right? Like sometimes if you ever had a therapist or you work with someone, even a doctor, you ever go to a doctor's appointment and you feel like they're just like kind of talking like medical at you and they're not really treating you as like an individual with like an individual problem, or they're like this, they're just typing the whole time, but there's no eye contact. I know I've had that experience where sometimes it's like, I want to know that like, you get what I'm saying and that like you're human. Right? I want to know I'm seeing a human here. I want to make sure you're, you know, to respect your profession and all your knowledge, but like it needs to make sense. It needs to make sense so I can implement that in my life. So I feel like it's definitely a thing that a lot of therapists, social workers use in sessions with clients, and especially with our survivors, they really, a lot of times with our volunteers and people that have had personal experience with domestic violence in some way, it's like, you get it, like, you see me, you've been through this. So like, I know that you understand this. And I think it goes really far, and it doesn't matter. I always say this, it doesn't matter if there's letters after your name, there's 12 letters, you have 20 degrees. I don't know. It does not matter. At the end of the day, it's about human connection and being real. So like, if you can do that, chances are you're able to help people. Um, so I always say that because I think it's important. So does anybody have anything about self-disclosure, any times where they've used it or in other settings, or anything that they have found helpful, not helpful about it? Okay.
Well, I know like in the recovery space, and I consider you're in recovery from an abusive situation if you're trying to get out of it. And it's helpful, when you're talking to somebody who understands, you can really tell the difference. And that's definitely something they talk about to use in recovery from, all kinds of alcohol or whatever. And
Yeah.
I think I see you can fit recovery techniques the same into recovery from abuse in a lot of ways, I think.
Absolutely. Yeah. You're right. I think you're right. I do think that it's almost like with recovery, the AA model, NA model, it's like when you have sponsors and things, it's they have to have lived experience, right? So they're not just like, I have a degree in substance use and mental health and I'm here to help you, right? Like, you don't have to have, obviously I have degrees, but I don't feel like that dictates if I'm going to be a good anything. Like, I really don't. So it's like when people are in AA or NA, it's like, okay, so let's say you have 5-10 years sober. I know you know what I'm dealing with. So when I'm coming to you at my lowest moment, I know you've been here. So you're helping me in a way that somebody else might not be able to help me because they don't know the trigger that I'm feeling. They don't know my want or need to use right now, right? But like, and I think
And
that's
it helps with building that trust that we were talking about before.
absolutely.
Yeah. It's hard sometimes, like I want to identify with everything and I gotta stop and like, no, don't, you can't say you've experienced everything everybody else has. It's sometimes hard not to identify too much.
It's true. It's because you just want to connect, right? You just want to be like, I see you, right? I understand. And it's like, yeah, I know how that could feel. Or you try to like apply it to like other situations to kind of show, like, try to bridge that gap, right? Which can happen. Yeah. Like, like kind of over identifying, which is easy to do. And like, yeah, for sure. 100%. Okay, so the next one. So why are boundaries important? So boundaries protect clients, survivors. Clients have the right to privacy, safety, and comfort. Boundaries establish a foundation of trust between survivor and advocate. Boundaries help a client in their healing process, protect clients from getting taken advantage of due to vulnerability. Boundaries set by advocates serve as a model that client survivors can use in other relationships. So the benefits is, better self-esteem, conserving emotional energy, more independence and agency. And a lot of times this is important too, because if we're setting boundaries, number one, with ourselves, then we're easier to set boundaries with other people. So even in like professional relationships, if we're like, hey, I'm gonna see you on Wednesday at 5 p.m., there is a sense of safety there, right? Because I'm gonna show up, we're gonna be there, and you can contact me if you need to, but like the boundary is you're always gonna get, for example, an hour from me a week. That's a guarantee, right? Unless something crazy happens, but you'll know about it. Um, and although sometimes setting boundaries can be uncomfortable, especially if we're not used to it, it's for the benefit of the other person. It's for the benefit of us. Because when there's loose boundaries or no boundaries, there's emotional instability. It's hard to regulate. It's hard to know what's expected. And as people, we want to kind of have some level of like predictability. Even if there's spontaneity and surprises, it's like we all kind of tend to want to know an idea. Like, for example, can you imagine if this training, like you had no idea when it ended and like you were just like, like what's going on? That would be anxiety provoking for everyone involved, right? So like there has to be like somewhat of a parameter so everyone can like informed consent is real, right? Like you got to know what you're signing up for. And I use the train as an example because I feel like it's important to know what the expectation is, what your time's valuable, right? So like you should know where it's going. Um, and I just think with clients sometimes that have never had boundaries or never experienced boundaries, there might be some pushback. Why are you being so hard on me? Why are you being so strict? What do you mean I can't email you at midnight, or something like that? It's like, well, you can, but you may not get a response until X, Y, or Z, right? So it's kind of like establishing like boundaries equals caring about someone. Boundaries is love. Boundaries is a level to connect with someone healthy. Like I'm honoring my boundaries, I'm modeling that. And I respect you enough to set these boundaries with, and I expect you to set those boundaries with me, right? Like it's a reciprocal kind of thing. Um, and I'm sure we can all maybe relate a little bit that sometimes in our personal relationships or, family, boundaries might not be a thing. We might have family members that don't really understand what boundaries are, right? And boundaries are different across the board, right? With different cultural beliefs, ways we grew up, religious backgrounds. I mean, there's so many variables that make boundaries a complex thing in a lot of family systems. And I say that because it's like we want to obviously respect also like our clients, like cultural backgrounds, how they grew up, how they were raised to be, and like make sure we're respecting that while also making sure they're respecting themselves and still setting boundaries if they feel they need to. And sometimes it's like this like tightrope, like trying to, stay on it, but it can be hard, especially in certain groups where it's like, enmeshment might be that's normal, right? Or even there's, certain racial groups where multiple generations live in one house. And that's just how it is, right? Versus in American culture, a lot of times it's like we are so individualistic, which I don't know if that's a good thing to be honest either, right? So there's nothing bad or good about it. It only becomes a problem if it's impairing that person or they feel that their boundaries are not being respected or they don't have enough individuality if that's what they want. So it's always a gray area because it depends on the person, where they're coming from, and do they see it as a problem? If they don't, that's okay. We're just supporting where they're at. So we will go to, okay, so I probably already said this, but so why are boundaries important? So setting boundaries is an act of self-love. So it's also talking about how they protect advocates, right? So a lot of times we talk about boundaries in terms of clients and emotional safety, but that's just as important for everyone here that's going to be working here, volunteering here, interning here, because your privacy matters, the level of comfort you have matters just as much as any of our clients or survivors. Um, Also, boundaries help buffer against burnout. um the helping relationship's a professional relationship, right? So it's easy sometimes to get caught up in our personal feelings about something or taking more responsibility over something that's really not our responsibility, right? Like we can offer resources, we can help as much as we can, but like, let's say you put your shift is 9 to 5, right? I think a healthy leadership or a supervisor would say at 5 o'clock, like I expect you to go home, right? There is no, you have to stay late or you have to make an exception or you have to do this, right? And a lot of work culture can be that way where it's like, you might get, your work week's supposed to be 35 or 40 hours, but you're expected to put more hours in. That's not really respecting boundaries of the worker, of the advocate, right? It's like your time matters. So let's respect that basically, right? And your safety and your boundaries and predictability, like all of that is just as important for all of you that it is for anybody that we help. Um, does anybody have any questions or any comments about boundaries or anything like that that's come up for them? Okay. All right, so the next thing we're gonna do is the self-care assessment. So you guys got a copy of the, I believe it was the direct service binder, right? From Shannon? You did? Okay. I'll pull it up too. 1 second. I had it. So it's on page 36 of the direct service trainer binder for spring 2024. And it's the self-assessment self-care assessment worksheet. So if you can easily bring it up, if not, it's okay also. We can also go over it together. But I was thinking what we could do is if we all take a few minutes to kind of fill it out. So it's basically just on like a rating scale. So it has like physical self-care, psychological, you have emotional, shit, what else? Um Emotional and spiritual. And then you just rate it on a scale of, I think it's 1 to 5. Yeah, 1 to 5. So like one never occurred to me, and 5 being frequently. And then the next one is develop a self-care plan. So what that is listing self-care habits and different questions just about like what your self-care plan is. So if you guys are comfortable, we don't have to share the results or anything unless you want to. But what I was thinking is we can do this and then kind of go over it. I was going to do it live too, and then we can kind of go over what we how we score and like what we found and stuff like that. So I think we should take a few minutes or however long it takes, and then we'll come back as a group and kind of talk about, maybe even if you don't get into specifics, like, what you've learned from it, if that sounds good. All right. Okay. So if people need another few minutes, take your time, no rush. Okay. Did everyone get a chance to complete the self-care assessment and the self-care plan? So this is not mandatory, nothing is here. So did anybody want to share anything that they found maybe surprising or anything that they learned about themselves when kind of going through the self-care assessment and the different categories and things that were kind of listed?
I mean, I listed the things that, I want to do more, but when there's like the obstacles in your way, like I can't think of any except, fear and lack of motivation. Like I should go to get more medical testing, but then like I do have like, what if I find out something bad? And that's not really a reason, I'm stuck for like darn any obstacles. I guess they're my own obstacles.
Yeah, definitely. And like fear is real, right? Like a lot of times, especially in the medical profession, like it's like a lot of times why people don't seek out doctors, myself included. I'm like, well, if I take this test, like then like I might have something I don't want to deal with. And now I'm kind of like living in like I don't have anything yet, I don't have any results of any tests because I didn't take it.
Yeah, but it's totally illogical. So I'm like, what's
Right.
stopping me? I don't know. I should go get these screenings and they don't.
Totally, totally relatable for sure. Absolutely. It's like things we know we need to do, but sometimes it's like, okay, so I have more things to add to my plate. Now I have to like make an appointment and go there and yeah, totally. Or like take off work or do that. Cause obviously the a lot of times the time frames are during daytime and we might have other responsibilities. So now it's like, I don't know if I want to like do all that right now, even though I know it's important. Totally. Does anybody have anything else that they want to share, just in general, anything that they feel like they either learned about themselves or anything that kind of came up for them?
I'm looking at the categories, the physical, psychological, emotional, and spiritual. And like again, there's fours and fives in like most of those. But the emotional ones, like it's mostly in the twos and threes. And I'm wondering like maybe I need to do more of these things.
Or
Yeah,
the
yeah, just like seeing those more like that's the low one for me, you know what I mean?
Yeah, definitely. Yeah, and I think too, like within self-care, we don't often look at like all the different categories, right? Of like, wait, maybe we do a lot in the physical, but with the emotional, it's kind of lacking. So maybe if I, increase that a little bit, maybe I'll feel a little bit more balanced, right? If that is how you feel. Not saying that's how you feel, but maybe it's like I could do a little bit more in that area. Yeah. Yeah, when I was doing it, I had a lot of twos and threes too, and I was like, oh, I ain't that good. You need to up some of this, like you're doing great in this category, but this one's kind of lacking. And so the one area was like, what are some things like with the self-care plan too, like what are some things you could work on that you currently don't do, right? Because it's like go to the gym. I haven't gone to I've joined every gym you could think of before, and I'm like, oh, I'm gonna go to this one because it's new, like that's why. No, it's the motivation. It's intrinsic, right? It's not about the gym you go to. We all know this, right? And I'm sure a lot of us can agree to this. That in theory, it sounds like a great idea, right? But at the end of your workday, the last thing you feel like doing is getting changed and going to the gym, right? Unless that's become part of your self-care routine and it feels like I crave the gym. I love the gym. I go there, that kind of thing. And then another thing was like, well, why basically what are the obstacles? And kind of related to what you were saying. I'm like, the obstacle is literally myself. There's nothing that prevents me from going. If I really wanted to walk there, I honestly could. So there's no excuse. But trying to practice some self-compassion, like lack of motivation is what I wrote because that's like true, right? Like, nah, I'm not motivated. If I was, I'd be there. Let's be real. Lack of motivation and just feeling kind of tired or fatigued, sometimes it's like, I don't want to do it. I don't want to do it. Just like the medical stuff, right? I know it's important to go to the doctors, but I don't feel like doing it. I don't feel like doing it right now. I just not in the space. Um, but I think sometimes, and I don't know if you guys feel this way, but sometimes seeing it written down, I don't know, it processes a bit differently. Sometimes it can hold us accountable in a different way to check in with ourselves. Um, I don't know, I feel that way. Like when I write something down, I'm like, oh, okay, it's like real. Okay, it's not just like a thought. Like this is like real. Like this is, and especially when sometimes you're talking about something you don't do and the reasons why and how you can implement it, and you're like, oh, so it's actually just me that's standing in my way. Got it. Okay. I thought it was other factors, right? Because it's easy to go there. And so I think this exercise is just an example of the ways sometimes we don't take care of ourselves, but we don't always realize it because we're so distracted or preoccupied with life, relationships, work, school. Maybe you're doing both. And you're like, I barely have time to sleep. So that's where I'm at. You know what I mean? Like it can be really hard. It can be really challenging. Did anybody else want to share anything? Could be specific, general, nothing at all. I'm open to whatever you have to share.
So I'm going to share where it said write in a journal. I'm being really specific, and I had somebody read a journal when I was younger. So I literally put a 1 there and didn't even read what the answer to 1 was, but I was like, I wish I could put a -15.
Yeah. Yeah.
And I'm such in a safe place now that I could literally journal. I have an amazing partner. I don't feel worried about people reading it,
Right.
but I'm still blocked there. So it's definitely something I was like, maybe I need to work on that.
I think thank you for sharing because that's
Of
honestly
course.
a vulnerable thing to share. But also like you're right, like that's a good example of like a trauma trigger that you might not have. It doesn't always like, it's not in your conscious awareness every day, right? That you don't journal. But then when you like put it, you're like, wait, like I had a strong reaction to this and this doesn't feel like self-care. This actually feels like traumatizing and like a violation of my privacy.
Yeah, definitely. Definitely.
And I think you bring up a good point too. I think a lot of self-care stuff, if you look at this list and some of them like, let's say you have medical trauma, right? You have trauma at the gym, you have trauma working out, you had an eating disorder, body dysmorphia. I'm just, then this thing don't feel like self-care. These feel like my trauma history. This kind of feels like a trauma history checklist now, right?
Absolutely. Absolutely. I definitely like know I've been like lacking on exercise and lacking on eating right. I work for a holistic doctor. That is my job. And I'm like, what are you doing? You're messing up. And I don't beat myself up, but it's
Yeah.
just a gentle reminder. This was a reminder too. I was like, oh yeah.
Totally. Don't you always feel like in certain, because I know like, so my partner, she's in the medical field, she's going to nursing school and she is the worst patient ever. Like she is by far the worst patient I've ever met. And she's always like, yeah, I know I should go to the dentist and like I should go to the doctor, but like I don't want to. And I'm like, you do this every day. But I get it though. Like it makes sense, right? It's like, yes, you have your rational brain and you have your emotional brain. So logically, I should be taking care of myself. I should go to the doctors. I should be doing these things. But emotionally, it's like I feel like there's a block there. There's some resistance. There's something there that's causing me not to do it. but I know I should be, right? And like, it's like, especially when it's like your profession, like it's like me saying, and this was true for a while. I've never been to therapy, but I'm a therapist, right? And I'm like, this feels weird. Feels a little weird, right? Like I feel weird not being in therapy. I feel like I'm kind of being a big hypocrite right now. And like obviously when you're working with clients and doing these things, like things come up for you, right? Like it's like, oh, it's like, oh, I don't have any like triggers that I know of until they happen. You're like, yeah, there it is. Right. So
Yeah.
I think it's an example too. Like, yeah, it's like, but it's like about motivation, where you are, like how busy you're, like, there's so many things that go into not doing what we're, supposed to do, or things to take care of ourselves. And I know I had mentioned earlier, it's like when things in life gets hectic, the first thing we throw out the window is self-care every time. Every time. We're like, we'll get to ourselves. We'll get back to that. We'll get back to that. Yeah, we'll get back in a routine. Yeah, we'll do the laundry. Yeah, we'll do. And then you have like, if you're me, you have like 7 loads to do because you just put it off all week. And then you're like, "Ah, I don't want to do this, So even
I
stuff
did
like
8 loads of clothes. I did 8 loads of clothes a week ago because I was just like,
you can you can
yeah,
relate,
yeah.
Hmm.
No, I mean we all do what we can do. Like I know like your partner is a nurse. Like I'm on the other end of it. I'm on the holistic end of it.
Exactly.
So your partner's like, man, I need to go to the doctors, and I'm like, man, I need to detox. Man, I need to do this. Like I just look at it like from the other end. Which today I did do a detox, which was great, but
Yeah.
I had Hershey Kisses all day. It's balance, I guess. I don't know.
I was just gonna say life's about balance, right? It's like,
Yes,
yeah,
it
it's like I
is.
did a detox, which I knew I was supposed to do. I wanted to do it. I knew how to do it, but I just had to get the motivation to want to do it today, right? But then
Mm-hmm.
it's like sometimes it's like, yeah, I had a salad for lunch. It was really good, and I was being good all day or whatever, you as fuel for food. And then like, did I drive through the McDonald's drive-through for dinner? Good chance I did, right? And then it's kind of like, I'm not gonna like, maybe I just needed that today. I know it wasn't a great decision, but in that moment, with the capacity I had, that was the best decision I felt like I could make for myself in that moment.
But do you hear what you're giving yourself right now? You're giving yourself grace. And that's what I think a lot of self-care for me has
Yeah.
been, is like, okay, I didn't make the best decision in this one moment,
Right.
but I realize that the next time maybe I'll make a better, and not even force myself, maybe I'll make a better
Maybe,
decision.
right? You give yourself a
Yeah.
little bit of leverage there, right? Like,
Mm-hmm.
yeah, I think
Yep.
that's super important too, because it's not like I have to be perfect next time. It's like, no, you don't. You don't.
Nope. Nope. All right. I'm gonna stop talking.
No, yeah, you're good. Thank you for sharing. That was really
You're
helpful.
welcome. Of course.
Definitely. And now let's see. Okay. So Molly had wrote that my husband is an ICU nurse, and he also is a terrible patient, never goes to the doctor, and must come with a career path. Definitely. Yeah, I definitely think that's the case. I'm like her like case manager. I'm like, so what specialist do you need to go to? Because this isn't preventative care. This is issues. You know what I'm saying? Preventative care, I can understand, right? There's a little more, you know, I get it, right? Like, go for your routine cleanings and this and screenings and all this fun stuff. I think it's easy to dismiss that, right? Like, I mean, I do sometimes. I'm like, I know I have health insurance, but like, I haven't really used it that much until I have a presenting concern. And then I'm like, I guess I have to call the doctor. Um, but yeah, I do think sometimes, and even in this profession, when you are in a caretaking profession, right, whether it's medical, holistic, therapy, counseling, being on the legal team, any way, shape, or form, we're so good at taking care of other people. Like we are excellent at it, right? We just are. We're just really good at it. But when it comes to ourselves, it's like, Hmm. There's a lot of room for improvement, right? There's a lot of areas where I can grow from. And I think, just really showing ourselves, like we just discussed, like showing ourselves grace and patience and compassion, just like we would for our clients, just like we would for our kids, our partners, our friends, our family, like to practice. Can you imagine if, and maybe some of you do this, I don't want to generalize this or assume how you feel about yourselves, but I think it's easy to care about other people and to put ourselves on the back burner because we're just caring people. We just love people. We're just like, yeah, Yeah, no problem. Yeah, I'll do that. Yeah, sure. And then you're like, what did I just agree to? It's like making plans and then like ahead of time, and then the day comes and there's nothing but regret. And you're like, I am not in the space to do, like, I am not the same person I was when I committed to this 5 days ago. It's like that. That's self-care. And then this is the self-care plan, and this the image about, like, filling up my cup, right? It sounds easy, but if we don't do it, we feel like there's like a drought, right? We're like, oh my, I can't take another phone call. I can't do it. I have nothing left. Like, it is nothing like this weather, right? Like, this weather has been like nuts, but it's like a drought and like all the plants are dead. Like, you have to water yourself, right? You got to do it, or else it's just not only you're going to develop physical symptoms, but emotional, like mental, not feeling like you can, you know, be present for yourself or be present for others. So obviously, self-care is very important. Is there anything else anybody wanted to add or share, or anything else that had come up for them? Okay. Um, and then a woman's place. So it's like, we're here to listen, not to work miracles. Very true. We are here to help people discover what they are feeling, not to make feelings go away. We are here to help a person identify their options, not to decide for them what they should do. We are here to discuss steps with a person, not to take steps for them. We are here to help a person discover their own strength, not to rescue them and leave them still vulnerable. We are here to help a person discover they can help themselves, not to take responsibility for them. We are here to help a person learn to choose, not to keep them from making difficult choices. We are here to provide support for change. And I feel like this is our philosophy in a lot of ways, because it's like, we're here to facilitate change if that change is wanted, right? If that change is wanted by that client, maybe it's not. Maybe they don't want to change. Maybe they just want to vent. Maybe they just want to express what they're going through. And hey, we're here, right? We're here no matter what you want. Let me see, there's someone in the. Oh, yeah. Okay. So let's see. Mel had written, can I share a book? Feelings buried alive never die. So go with body and stress. Awesome. Thanks for sharing. I feel like resources are always helpful, honestly. Um, And if you like to read, I mean, I think it's good to have some things that you can read on your own time just to kind of supplement, everything that we learned. I'll write a few things too that I feel like are very specific to domestic violence and trauma, but very similar to what Mel had said there. It's a lot about the way that trauma is stored in the body and the way that it presents. So if anyone's interested, I will write down some of those if anybody. There we go. Thank you so for. These are a couple of books that I really think are helpful. And so basically these are the first ones about how, like, trauma is stored in the body and how sometimes we might experience triggers and things like that, or have somatic symptoms related to our trauma. So like the body keeps the scores, like the body doesn't forget the trauma, even if our thoughts and feelings and things are repressed. And then the second book I wrote in there is called No Bad Parts. And what that is I operate from like a IFS perspective. It's like a interpersonal family systems, and it talks about how every person is made up of parts, and we have all different parts of us. And this book really highlights that, like, none of our parts are bad, and we've developed these parts of ourselves due to trauma, due to life experiences, because these parts have served to protect us, or they have served to, really keep us safe in certain situations when we're in survival, fight, flight, or freeze responses. So I like it because it explains it in a way that just like isn't so like clinical, like it just makes sense. And I think everyone can relate to it, and it highlights a lot about trauma and how it impacts like our personalities, the way we show up for people, the way we show up for ourselves, all of that kind of thing. So thank you for sharing, Mel. I love resources. Resources are great. Is there any concluding thoughts, questions, concerns, anything that has come up? I know we've been together almost 4 hours. We got to know each other a little bit. Anything that anybody wants to ask or add or anything like that?
No, but thank you very much, Sarah.
You're welcome. It was nice meeting with you guys and being able to, talk about the stuff. I'm very passionate about it. Try to make it as interesting as possible. I know 4 hours can be a long time, so make sure that everyone's feeling okay and can practice, some self-care tonight, a lot of learning is done. So
Well, you did a great job.
thank you. Thank you. I really appreciate that. Oh, and then the last thing I know you wanted, Brian, you mentioned the TED Talk link for, yes. So let me send that to you guys too. Do you want me to put it in the chat or do you want me to email it to you guys? Would that be easier?
Whichever works. Also,
Okay.
are there copies of these slides? Because I feel like there's stuff I want to look back at.
Sure. Yeah, I don't think there should be an issue. Yeah. I'll double check, but I'm pretty sure I could send you that stuff. I have your guys' email. So what I can do, I'll double check on that. It should be fine. And then I'll send the link with the TED Talk. Because I know in the chat sometimes it just disappears and then you don't have it. So yeah, so I have your email addresses and names and everything. So I will double check about the PowerPoint link because I never did it before. But I'll double check and then I'll send you the link for the TED Talk. And then obviously if there's any questions or anything for me, I want to provide this too. Did I delete the last slide? Maybe I did, yeah. My information too, if you ever wanted to contact me. So real quick, I guess I'll just write in the chat now since it's not showing up. Give me 1 second. Remember that time that I didn't know how to use the Zoom? Yeah. Okay. So my email address is, this is where the email will be coming from too. So- and then this is my work cell. If there's any questions or anything comes up too. So yeah, so that's in my information, and I really had a good time with all of you. If there's any follow-up questions, feel free to email me, or that's my work cell if you need to contact me. But I look forward to all of you. I'm sure I'll work with you guys in some capacity, which will be nice. And I hope you guys have a good rest of your night and you have 15 minutes to relax. So that's good, right? So yeah.
Thank
Okay.
you.
You're welcome.
Thank
Thank
you.
you so
Thanks,
much. This
Sarah.
is great.
Appreciate it.
Take care, everyone.
Take care.
Bye.
Bye.